Okay, good morning. Welcome to the Thurston County Board of County Commissioners Agenda Setting Work Session for this Tuesday, December 7th, 2021, 9:04 a.m. My name is Ty Menser, Chair of the Board. In our boardroom is Vice Chair Commissioner Gary Edwards, Commissioner Carolina Mejia. Also on Zoom, we have County Manager Mira Chavez and Assistant County Manager Robin Campbell in the boardroom, and a whole bunch of staff members through Zoom for this hybrid meeting. Which is slated to last till 12. And we are live streaming it on our Thurston County YouTube channel. So we'll go right to item number 1 this morning, which is a COVID-19 update.
Good morning, Commissioners. Today is day 671 of Thurston County's COVID-19 emergency response. In Washington state, thus far since the pandemic began nearly 2 years ago, there have been 784,129 confirmed cases in Washington state and 9,436 deaths. This includes 23,288 Thurston County residents that have been confirmed to have COVID-19 since the pandemic began, and 507 new cases reported to our department this week. That puts us at 292.4 on the governor's risk assessment dashboard over the last 2 weeks. There have been 243 Thurston County residents that have lost their lives due to COVID, and 5 new deaths reported to us in the last week. 1,438 Thurston County residents have been hospitalized due to COVID-19. There were 10 new patients admitted due to COVID complications to our Thurston County hospitals this last week, and currently 37 COVID positive people inpatient at our local hospitals, and 21 of those are on ventilators. Our hospital capacity remains high, but continues to be stable at this point. Our acute bed capacity is at 97%, and our ICU capacity is at about 75% as of this morning. We've had 105 congregate care outbreaks to date, 7 that our team are currently investigating, and 1 new reported to us in the last week. We continue to make progress in vaccinations. To date, there have been 425,414 doses of COVID-19 vaccines administered in our county by all vaccine providers, including Thurston County Public Health and Social Services. 64.8% of our total population has initiated at least 1 dose, and 59.7% of our population is considered fully vaccinated at this point. 76.9% of those 16 and older have initiated, and about 71% of 16 and older are fully vaccinated. Among those 12 and older, 75.5% have initiated a series, and 69.6 of those 12 and older are fully vaccinated. Among 5 to 12-year-olds, approximately 22% of those eligible in Thurston County have initiated vaccine yet. Enough time has not gone by yet for us to be able to report fully vaccinated numbers in that age group. But that's really good news, and we hope that people will continue to get vaccinated. I want to say a special thanks to United Way of Thurston County and all of our staff and volunteers, as well as our Medical Reserve Corps members that continue to help us administer vaccines here in Thurston County. On this Sunday, we had a very successful mass vaccination event at the Thurston County Fairgrounds, administered 510 doses, and at our mall site that day, 345 doses were administered. So that's 855 doses of vaccine administered in a single day by Thurston County Public Health. I really just want to say thank you for those efforts. That's a record number of vaccines in a day. We continue to have appointments available for both initial doses of COVID-19 vaccine, boosters, and pediatric doses. Encourage members of the public to check our Thurston County Public Health website or DOH's vaccine finder to find an appointment for you if you've been looking for one. And finally, we did report over the weekend that we have identified a confirmed Omicron variant case here in Thurston County. This is concerning to us. I know Dr. A has more to add on this, but I just want to implore again, members of the public to please, if you have not already got vaccinated, please get vaccinated. Please get your children vaccinated. And please continue to wear a mask and gather responsibly. We expect that we will see a rise in cases. This puts a pressure on our healthcare system, pressure on our public health system, but most of all, it prolongs the end of this pandemic. So please do that, and I will pass it over to Dr. Abdulmalik, our Incredible Health Officer, to add anything or share more.
Good morning, commissioners. Over the weekend, we did report our first confirmed Omicron case in Thurston County. It was one of several cases that were identified in Washington State. What I'd like as the main so we have been seeing cases of Omicron pop up around the country and around the world, and there has been a lot of concern. What the CDC has really shared with us in scientific briefs, as well as in summary documents, is that based on what we know about the Omicron variant, all of the mitigation measures that we've been using to prevent the spread of COVID-19, including masking, staying in well-ventilated areas, distancing, staying home when sick, and getting tested, are all still effective and critical ways that we can prevent the spread of this new variant, as well as other circulating variants. We are still learning about the specific efficacy of vaccine regarding infection, but we anticipate, and the CDC is confident that the vaccines that we have that are currently available protect against severe illness and death, including from the Omicron variant. This is still early and we're still learning, but the best thing that people can do to protect themselves and their communities at this point in time and prevent transmission of this virus is to get vaccinated when eligible and receive their booster dose when eligible as well. We anticipate that there will be some changes in terms, and there has been some updated guidance from the CDC regarding international travel, including viral testing for all people. The recommendation that all people, regardless of vaccination status, test 3 to 5 days after international travel. As well as a quarantine guideline for folks that aren't fully vaccinated who travel internationally. We are in a dynamic state each time a new variant arises. There's a process as scientists, doctors, and folks in public health come together, share information, share patterns of spread, share experiences, and share knowledge as we learn more about this variant. And with that, I'm happy to answer any questions you may have.
Commissioner Mejia?
Yes, I have a couple questions. First of all, I just want to echo what Shelley said. I attended the Fairgrounds event to get my daughter vaccinated this Sunday, and we were actually the last person to get vaccinated. My daughter was. And I really, I saw the volunteers, and again, just thank you to United Way to really help us coordinate all of this and have a successful event on Sunday.
Commissioner?
My questions are for Dr. A in relation to the Omicron variant. Do we know if they were Can you hear me?
Yeah, your connection is not very well. It's not very good. So your feed is skipping.
Can you hear me now?
A little bit better.
A little bit better.
Yeah, it's better.
Okay. My question's for Dr. A, in regards to the Omicron variant. Do we know if there's a connection with any of the other people in Washington who got that variant as well?
So at this point in time, there's coordination between counties to see if there is a connection. But we don't actually, but we don't comment on ongoing investigations at this point, but there is a coordinated effort to determine that information.
Okay, thank you.
Mr. Edwards.
No questions, sir.
Okay. I also got a chance to see the vaccination clinic in action by accident, actually, as I was attending a Fair Board event, but it was good to, it was quite an operation, and I was glad to see that. Just a random question. Earlier on, we were often emphasizing the test positivity rate. Is that not as important? I mean, I haven't heard that statistic. Maybe you hit it and I just missed it, but I feel like we haven't been hearing that statistic in the recent weeks, and I'm just wondering why.
No, you are correct. And it is still an important metric that can tell us a lot about community transmission levels. However, we have not been able to get that data from Washington State Department of Health since the end of August, I think early September. So we don't have up-to-date data to share at this time. I know there was an incredible backlog of negative cases that they had to report that their team was working on. And we believe that they will soon be able to catch up, reconcile that, and begin reporting that state as well as county by county test positivity information again soon, we hope. As soon as we have it, we'll be sharing it.
Okay, thank you. That answers that question. County Manager, anything?
No, thank you.
Okay, thank you, Shelley. Thank you, Dr. A.
Thank you.
Next is Homeless Strategies Update. Keely Marino, good morning.
Good morning. Keely Marino with Public Health and Social Services with a brief update for you today, starting off, as always, every week with an update on our rental assistance program dollars and where they're going. Starting off with Community Youth Services, who's serving households with individuals between the ages of 18 and 24. They've served a total of 132 of those young adult households, and there's 234 other applications that are actively in progress. And they've paid out over $1 million in rental assistance at this point. Community Action Council has served 3,169 households in Thurston County and spending over $22,260,000 in rental assistance and about $1 million in utility assistance. To address some of the questions that came last week in conversations with Community Action Council, they have a new phone system that they've on their own accord have reached out and got a new contract, excuse me, for a new phone company to address any issues of disruption with regards to calls. They've extended their appointment times from 2 weeks to 3 weeks out, and they are undergoing an audit through Brandon Weber from Thurston County is providing an audit. And so we may have some suggestions for CAC following the results of that audit. Regional Housing Council is meeting tomorrow. The Regional Housing Council meets monthly, and they meet from 4 p.m. to 5:30 p.m. to register for public comment or just to attend via YouTube live stream. You can Google Thurston County Regional Housing Council and go to that website, and it will take you right there. It's really clear how to join if you would like to attend or make public comment. And then finally, of course, we have the sweep that is happening tomorrow with the Chutes Parkway. Significant amount of meetings and planning and attempts to mitigate any unintentional harm in that process have been ongoing. And I will be there tomorrow off and on to provide any support that I can but I know that it's been a pretty broad effort to get as much support as possible. So, and from what I understand, they're starting to move some individuals into hotels today. And that is what I have for you.
Commissioner Mejia,
No questions for me. Thank you.
Commissioner Edwards.
I guess I'd only point out that the start of a homeless camp out on 101 still looks like a junkyard, and it's getting worse every day. That's it. Thank you.
Keely, the Olympia's actions that they're going to take on Upper Ensign, has that started, or is that coming in the future, or what's the timeline on that?
Yes, the sweep of the upper part of Ensign Road between Providence Lane and Lily Road will commence on Wednesday, the 15th. So 1 week from tomorrow.
Okay, thanks. That's all I had. Okay, thank you, Keely. Let's go to item 3, budget public hearings. And we have a schedule, and I'm not sure what the idea was here.
Yeah, and this is, you started the budget public hearings this yesterday, and it was posted. And this afternoon, you will begin your budget public hearings at 1:30, where you will hear presentations related to transportation, environment, and land use, which includes the community plan, economic development, and public works. At 2:30, you will have the public hearing related to health and human services, which includes public health and social services and emergency services as well. You will break from just about 3:30 to 4, depending on how the public hearing goes. And at 4 in the afternoon, you have a public hearing related to the revenue to support the budget. That includes the property tax levy. And again, depending how that public hearing will go, is scheduled a break between 5 and 6 in the afternoon. In 6 in the afternoon, you have an overall public hearing to receive public testimony and any aspects of the budget that has been proposed. And at that point, I will ask you to formally close the public hearing related to 2020, the proposed 2022-2023 biennial budget.
So
Question?
this is just to go over that overview schedule.
Yes, it's just for the public information, maybe. I know that you're tracking all this.
Commissioner Mejia, any questions on this item?
No, sir.
Commissioner Edwards?
No,
I have a question. So on the last segment from 6 to 7, is Robin going to be reviewing the same slides, or is she going to sort of rely on the presentation from yesterday?
So I will not be reviewing the same slides. This evening I'll do economic overview and just
Okay, so it'll be a different
different.
presentation.
Yeah.
Okay, I'll just point that out if the public wants to. Last night we had an open session. Tonight we have an open session, but there's different material presented. So you might want to catch up on the live, on the video to see the overview of the budget that the Assistant County Manager presented last night. Okay, let's go to item 4, which is a review of the draft agenda for the 12-14 meeting. I guess that's a week from today. And that meeting will be called to order at 2 p.m. Pledge of Allegiance to be led by Commissioner Mejia. We will contemplate the agenda and board meeting minutes from the 6th and 7th of December. The public will have the opportunity to address the board. The county manager will provide any updates that may be required or desired. The consent agenda is 5 items. 3A is central services, ER&R equipment, external user rate review.
Thank you, Commissioners. The board approved the rates for ER&R. They're annually based and prior to the last year's expenditures to operate and maintain and replace kind of equipment. For public works particularly, we need to set some rates when we rent equipment to external customers. And that is coordination with the many jurisdictions perhaps, that we provide services as needed. And the board needs to adopt those hourly rates on an annual basis. Just to give you an example, for light trucks for 10,000 pounds, the hourly rate is $21.09. For medium trucks, it's $23.11. For regular service trucks, which is an F550, $37.89. For a dump truck is $159 per hour. Low boy is $52.43. And there's a series of other equipment we established as part of the potential hourly rate when we provide services to other jurisdictions. And again, this is a yearly event. I think Bruce from the manager from ER&R is here to answer any questions you may have related to this item.
Commissioner Mejia, any questions for Bruce?
No, sir.
Commissioner Edwards?
Yes, I take it these are going to be the current rates, and they must be adjusted up from something. Are we gonna see what it was? And the reason I'm interested in what it was, I like to know about inflation and what kind of an impact that is having on our overall operation.
So this is the first year that we've implemented this process or concept of an hourly rate. Previous years, the board approves an annual rate, which is not suitable for billing by the hour. What we did in this case is we simply took the already approved annual rate and divided by the operating hours in the year that those costs were incurred. So I don't have trend data for you for hourly operating costs.
Okay, but it sounds like the rate then is not gonna change from what it was last year then, apparently, right? Just you're dividing it out.
So these rates reflect our 2020 operating costs divided by 2020 operating hours. And as far as the question about how they reflect inflation, what will happen is next year's rate or 2023 rates will reflect 21 costs and hours.
Okay, so you're starting a new process here.
Actual costs on a 2-year lag.
Okay.
Okay, thank you. I don't have any questions there. Let's look at item 3B, the Sheriff Department item, intergovernmental agreement with the National Cooperative Purchasing Alliance.
Thank you, Commissioner. The Sheriff's Office is requesting for you to authorize an intergovernmental purchasing agreement with the National Cooperative Purchasing Alliance. Washington State allows, as well as the county's procurement process, to piggyback on a government agency that has gone through the competitive process. In this case, the Sheriff's Office would like for you to authorize this agreement to set the stage in 2022 to purchase body cameras and vehicle cameras. I know this has not been approved in the budget, and that this particular item will be pending your final decision in authorizing that purchase. I believe the Sheriff's Office would like to be proactive to make sure that if the board approves this contract is in place, so the purchasing of the body cameras and the cameras on the vehicles can start right away in 2022. Under Sheriff Brady is here if you have any questions related to this request.
Questions from the board?
No questions.
No, sir.
Nope. Okay, me neither. Thank you, Under Sheriff.
Thank you, Ray.
Actually, a couple more sheriff items. Next one is lease with Lacey Fire District Number 3.
Yes, thank you, Commissioners. The Sheriff's Office used to maintain a detachment on East Olympia. That particular space was no longer available, and the Sheriff's Office needed to move out of that. Through this process, the Sheriff's Office has reached an agreement with the Lacey Fire District Number 3, where they can be utilizing portions of their facility located on 8407 Steilacoom Road Southeast in Olympia, Washington. And they will be accessing portions of that facility, not all, It will be providing office space, kitchen space, bathrooms, as well as designated parking for the detachment. And the lease cost of this particular lease is $125 a month. And the proposed lease is for you to consider having a 5-year lease with the option of extending another 4 to 5-year terms. And again, the Sheriff Brady is here to answer any questions related to this proposal.
Questions on this one? Commissioner Mejia?
No, sir.
Commissioner Edwards?
No, thanks.
Okay, good to go. Item 3D is a waiver of competitive solicitation and contract with Tactical Athlete Performance Institute LLC.
Yeah, as part of our procurement process, the board could approve a waiver of competitive solicitation under the county's procurement policy. In this case, is with Tactical Athlete Performance Institute in the amount of about $26,950 plus tax. This particular outfit will provide an integrated, comprehensive, and personalized health and performance program for employees that are injured on the job. And this will be related to the Sheriff's Office specifically. These efforts facilitate the employee getting seen by a medical professional quickly, thereby decreasing the time for diagnosis, treatment, recovery, and they can return to work rather quickly. So as part of the process, any type of waiver of competitive solicitation is to be reviewed by the internal auditor. And the internal auditor has concluded this is an allowable item for you to consider waiving the competitive solicitation. So, and again, Under Sheriff Brady is here to answer any questions.
Commissioner Mejia?
Yes. When would this start and when would it end? Is it for like a year, 2 years?
Yeah, so if approved, we would plan to start this on 1st of January of 22. It would be a 1-year trial. We would revisit it in November to determine if that's something that we want to move forward on. We've had quite a few talks with Tammy in risk management as well, who's supportive of this program. And in talks with her, our plan, if we like the program after the 1-year trial, would be that this would be passed through funded, still paid by the Sheriff's Office, but passed through her office as a workers' comp cost.
Okay.
Commissioner Edwards?
No questions, sir.
So,
And the action that's on the consent is just, it's not a budget decision we're making. It's about just the waiver of bidding. Is that the nature of the action?
That's correct, sir.
Okay.
Because I assume that we cover part of the Sheriff's Office next year budget.
Okay, very good.
I was hearing a confirmation. I'd like to have a confirmation from Ray that in fact this is going to be covered by the Sheriff's budget in 2022.
right, will this be absorbed?
Yes, that's correct. The cost is approximately $275 per employee, and that will be covered in 22 by the Sheriff's Office.
Okay. That we've looked at this in the past, and this is the first time I've heard that the Sheriff's Office is willing to absorb the cost.
Yeah, the cost has come down substantially, as my understanding from the past, and we're going to do so, move forward if approved on a trial basis. I've spoke with my counterparts at Pierce County Sheriff's Office, who's used this for a few years, and their cost savings is pretty astronomical, in the hundreds of thousands of dollars they've saved by using this program.
I agree, but based on what I've heard about the program and over 2 years, I believe, I think it's something that may be valuable for the Sheriff's Office. Under Sheriff Brady, could you revise the action to include this is a pilot program for 2022, considering what you just stated, that you're going to be evaluating the merits of this program at the end of next year?
Yeah, I'm just reading through real quick, sir. I believe I thought that was in here. That may not have been what's submitted. I know for a fact that that's what is on the agreement
Okay.
with it's called Rebound is how they operate here in Washington State, but it's through Tactical Athlete. But yeah, so certainly if we need to revise things to make sure that it states that it's a 1-year trial.
Yeah, that will be clear, if you don't mind. Thank you.
Okay, very good. Item E is auditor voucher list items. Any questions from the board?
No, sir.
Okay.
No, sir.
All right, then item 4A is an auditor department or an auditor item.
Yeah,
Purchase a ballot sorting machine with Runback Election Services.
Yeah, thank you, commissioners. This is an item for your consideration. The Thurston County has a cooperative agreement with Pierce County, where we can go through the process of purchasing equipment while Pierce County has gone through the regular and required bidding process. In this particular case, the auditor's office would like to purchase a sorting machine related to the elections. And I believe they have already confirmed with the vendor. They have the equipment, and they should be, if you approve, they should be delivered by the end of this year. It's already included on Fund 1090, which is the elections fund, which is dedicated fund, is not part of the general fund. I know that at this point you don't have a dollar amount. And I believe the auditor's office is in the process of negotiating what the actual cost is. And when that becomes known, we will add this a dollar amount for your consideration next year. Diana Benson is here from the auditor's office if you have any questions related to this item.
Commissioner Mejia?
No, sir.
Commissioner Edwards?
Yes, is there a bidding process that's taking place or foregoing?
Because they, similar to other items, similar to what the sheriff's office already stated, under state law and also procurement process, we can piggyback on another local organization.
That's what we're doing. Okay.
And in this case, we're piggyback on the contract that Pierce County has.
Okay.
So, and that is allowable.
Thank you.
Okay, thank you, Diana.
Thank you.
Commissioner,
Item,
before you move into the other items, I had one item that might be coming to your attention next Tuesday, and that will be a human resources item. Considering this is the last meeting, I will be working with Marianne to bring a proposal for you, and next Tuesday we'll walk you through the details related to implementing revisions on the holidays for county employees, including the Juneteenth, and also some of the holiday revisions they have been negotiated with the unions. It's going to be a little bit of more in detail that I will bring you this for your consideration next Tuesday morning. We'll review the item in more detail, but you will see this item on your agenda in the afternoon. And again, we need to go through that process, and I apologize for the delay on this.
okay. 5A, Essential Services Contract Award for Countywide Janitorial Services.
I think part of the conversation this week was where the janitorial services will go through. And September 2021, the board authorized Essential Services to go through the Department of Enterprise Services, their master contract, to secure bids related to janitorial services provided to the county. There were 6 available janitorial companies that provided proposals, and at this point, I believe they continue to negotiate with the proponent, the final vendor, and that's where you see the question marks and perhaps the X's, because we have not gone through that process yet. And I know for a fact that the contract, that janitorial services, ends at the end of this year. So we'll bring the results of the bidding process in more detail next Tuesday morning. But again, I just want to bring you this item to your attention that we have completed the selection for the vendor to provide janitorial services, and that will be on your agenda next Tuesday afternoon.
Okay.
I know your last meeting is next Tuesday. That is why I'm going through this. My apologies.
That's all.
Commissioner Mejia. Commissioner Mejia.
No questions so far.
Yeah, and my apologies, just to bring it to your attention, I know that the access is really what the board is interested in, and we'll make sure, hopefully this week, we'll give you a heads up before Tuesday morning, so we have the opportunity to review the proposal.
Commissioner Edwards.
Well, I'm fine, thank you.
Okay. Okay, 5B, on-call design and engineering services contracts.
Yeah, on May 8, 2018, the Board of County Commissioners authorized Central Services Department to solicit requests for qualifications to negotiate and execute contracts for on-call consultants providing various services, including design and engineering services, to all the facilities in the county. That particular contract resulted in 16 different consultants that we utilize through this process. In this particular contract expires December 31st, 2021, and the Central Services is requested for you to extend for 1 year till December 31st, 2022. And those services that we have used in the past is for facilities repair, maintenance, allow capital projects to continue without interruptions. We don't have the level of expertise related to HVAC systems and all the many different elements the facilities go through this process. And having a pool of consultants available for them to give us the professional perspective, it really has paid off in getting us through the projects that we need to do on the many different buildings that we have in the county. Robin Campbell is here if you'd like to add any additional perspective on this.
Just that we've looked at other ways to procure these services. Using the MRSC roster is not efficient, and the Public Works similar contracts are not for the type of services that Central Service uses. So we do need our own set of contracts to be able to have on-call design and engineering services.
I do have a question.
Go ahead, sir.
MRS.
MRSC.
Municipal research.
Right, I'm just asking for the public. I know what it is, but.
Services Corporation.
Yeah, that's right, municipal
It's
research.
where we get tips about government, right?
Yep, they assist local, both at the county and city level.
And do we have an existing contract now that we're gonna extend? Is that what I'm hearing?
Yes.
And is it with one particular outfit, or is it with 16 different outfits? And somewhere along the line, there must have been a bid process or something that
Yeah, back in
took place.
2018.
Yep.
And we selected these 16 outfits
Yeah, there's
at that point in time.
that is correct, sir.
When we're gonna do something like this, I know you try to keep the verbiage down on our action here, but will it show the 16 outfits we're utilizing that we're extending? Would that show in the EIS?
The actual names?
Yeah, does it? I mean, I just wonder for the public wanting to know who we're doing business
We
with.
have in the documentation of the EIS, do you want to have the 16 outfits on the action?
No, not on the action. I was just wondering if it is in the paperwork, if somebody was
It
interested.
should be, yes, included on the backup.
That's fine. I just wonder if it's there. So, good. No, that was my only question. Thank you.
Commissioner Mejia, anything?
No, sir.
Okay. Let's look at item 6A, resolution for property tax levy certification.
Yeah, thank you, commissioners. You will see an item next week. Under RCW 8452-070 requires the legislative authority, you, in each county to certify the amount of property tax levy to the county assessor, and that needs to occur prior to December 14 of each year. This particular certification includes the general fund, the roads, medical, and the conservation features, and that is stated by law that we need to certify that to the assessor in order for us to position ourselves to receive the money next year. Robin is here to answer the particular questions related to this particular item.
I would note that, as you see, it specifies 2,750,000 for the levy shift. And that amount will be adjusted once the board determines how much you'd like to reduce it in the final budget deliberation.
Starting tomorrow morning.
Yep.
So that doesn't reflect any reduction from last year? It's the same?
That's correct. The motion will be changed to whatever the board determines in the final decision.
Commissioner Mejia?
I have a question about that, but aren't we, the final adoption of the budget, isn't it that the 17th and this is the 14th?
Yes, the levy must be certified to the assessor no later than December 15th. So
Okay.
this action is on next Tuesday.
Okay. So on Friday, we can't, there's no changing your mind. Is that what I'm
That's
hearing?
whatever you decide next, on, well, and actually whatever you decide this Thursday, after Thursday, it's extremely difficult for staff to change all of the documents that we need to have you adopt.
In the property tax levies, for instance, in the last 6 weeks, we have received many certifications from individual junior districts, fire districts, the cities. Everybody goes through the certification process. And Amy facilitates that certification process, and we forward that to the assessor, because that really creates the umbrella as to how the property taxes should be received and distributed. In this case, is the Thurston County. The county itself needs to certify that levy on a yearly basis.
Commissioner Edwards?
No, I think I'm okay with this, thank you.
What, besides the levy shift, are there other policy decisions that are embedded in this action? It's hard for me to tell the way it's worded. Is this, but from the 1% to the, all the different pieces, or is this just kind of like taking the junior districts and it's more of a paperwork thing we have to officially sign off on the, what's embedded in this action besides what's on the surface of it?
This action is specifically for the county property tax levies. And the levies include the 1% councilmatic increase, plus the levy increase for new construction. I'll go through all of this tonight, but the 1%'s in here. The new levy rate that the voters approved for Medic 1 is in here. The levy shift from roads, 1.5 million for road diversion. But other than that, it's your standard levy calculation.
So last year we had to go through a process related to, because a certain index wasn't at a certain point, we had to do special resolutions. We haven't had any discussion of that. Can you?
The reason you haven't had to talk about that is the index is above 1%. That's inflation, and it's not the CPI, it's the IPD. And the IPD this year is, I think it's closer to 3%. It's well above 1%. If it's under 1%, then the board, because, I'm going to step back a moment, the law allows the board to raise the levy by 1% or the IPD, whichever is less. That's where the 1% cap comes in, because usually the IPD is above 1%. But in the years that it's less than 1%, then the board may adopt a resolution of substantial need. And after you do that, then you can still raise it up to 1%, the full 1%. But this year, the IPD is above 1%, so you have not heard me talk about any of that.
Okay, very good.
No, but good recollection, Commissioner, because last year, yeah, it was under 1%, so you needed to take 2 actions if you wanted to reach the 1%, in this case, only 1.
And it was 2 actions, but it was also per levies. There was like a special one for conservation futures. There was a special one for Medic One. There was so it was really quite a production of resolutions and stuff. And I don't want to get hit with that at the last second, but it sounds like we don't have to worry about it.
Correct.
Okay, any further final follow-up before we move off of this item? More to come on this one, it sounds like, based on our decisions later this week.
Yep.
Okay, hearing none, we'll go to 6B, resolution for Thurston County Council on Racial Equity and Inclusion.
Commissioners, we introduced this item for you last week, and I asked for you to provide any comments related to the proposed resolution. I received comments from Commissioner Menser, and if you have any comments for the 2 commissioners, please give me some feedback by this Friday, and we will incorporate those comments on the resolution, and this will be for your final consideration next Tuesday afternoon. Nicole, you want to add anything else?
Good morning, Commissioners. I do want to add that I have, since you've received the draft resolution, it has been sent to legal. And so she provided some feedback for me that I have incorporated already. It's not significant content differences, and I can just go through some of the changes really quickly if you would like me to. We just moved some things around, if that makes sense. Do you want me to go through what was changed?
Not go through it, but I don't know what my other teammates feel, but if you could send it to us that way.
Okay. Yeah, it doesn't, again, things weren't, the content wasn't significantly changed, just sections were moved around. And so I can send you that, that draft update.
Yeah, can you send the red line version?
Yes.
That'll be good for me as well. Okay, thank you. Okay, then we'll go on to item 7A. Community Planning and Economic Development. This is a contract for hearing examiner and administrative hearing examiner services.
Yeah, Commissioners, you may recall earlier in the year you authorized the Community Planning Economic Development Department to go ahead with a request for proposals to secure the services of the hearing examiners. The result of that process is for your consideration is to award the contract to Ms. Sharon Rice. And that will provide the hearing examiners for the community planning, economic development, as well as public health and social services. Ms. Rice has been serving as the hearing examiners for quite some time, and I think she has been proven to be extremely effective and comprehensive, as well as very objective. For your consideration is to award the contract to Sharon Rice Hearing Examiners PLLC, and that will be for the performance of the contract will be from January 1st, 2022 to December 31st, 2025. Jeremy Davis has been managing this particular process and is available to answer any questions that you may have.
Questions for Jeremy from the board?
No questions from me, sir.
No? All right. Good to go. 7B, contract amendment with Thurston Regional Planning Council regarding Boundary Review Board.
This particular contract, a few years back, the board made a decision to award the contract to Thurston Regional Planning Council to provide administrative services related to any proposed annexation. They have served as the clerk related to the proposed annexations, and it has been proven a very good process since before then used to be Jeremy who used to do the clerk services to the Boundary Review Board. By having a third separate outlet provides a little more objectivity. Not that Jeremy didn't have that objectivity, but I think the appearance, it was there. So this particular contract is to continue the services clerk services required by the Thurston County Bond Review Board with the Thurston Regional Planning Council for the upcoming year. And I believe the contract is still for $20,000. Jeremy, would you like to add anything else?
Commissioner Chavez, I do not have anything to add to your summary. Thank you.
Anything from the board?
No questions.
No
from me,
questions.
sir.
All right. Then let's move on. 7C, setting a joint public hearing with the city of Tumwater for island annexation interlocal agreement.
Yeah, Commissioners, you had a conversation maybe 4 weeks ago related to this particular items where the city of Tumwater has submitted the proposed annexations to pretty much deal with all the islands within their city. They're surrounded by the city limits. That has been a strategy the board has taken in the last few annexations. In the city of Tumwater, I appreciate their willingness to have a comprehensive approach to look all the many different islands that we have within their cities, and this is the proposal to that. You review, I believe, this proposal 3-4 weeks ago. I was not here when you reviewed the item, but I believe the decision of the board was to hold a joint public hearing with the city of Tumwater related to this particular proposal. This item is scheduled for January 18, 2022 at 7 in the afternoon. I'd just like to probably remind the board you do have the option to have your own public hearing without having a joint public hearing. But I believe the desire of the board at that time was to have a joint public hearing related to this item. Also, what I'd like to ask, if you decide to go ahead with a joint public hearing, my suggestion at this point will be to have a virtual public hearing, because that will really facilitate coordinating with all the different council members and in the Tumwater Council as well as the public, because it will be very difficult to find a joint in-person room that will accommodate the Board of County Commissioners and the City Council members in a single room. So if you approve this joint public hearing for January 18, 2022, my recommendation is for just go virtual public hearing. And Jeremy is here to answer any questions again.
Commissioner Mejia?
No, nothing at this point. I guess I'm just taking it in.
Yes, no question at this time.
Okay. I don't believe that I do either, so.
So Jeremy, based on the feedback, I'll the lack of, we go with a virtual public hearing based on the dates that has been set up in this action.
Thank you.
Thank you.
Is there going to be we've never had a joint public hearing with another jurisdiction. Is there going to be given that it was slated to be at the Tumwater City Council, does that mean the mayor of Tumwater presides over it, or what's the plan on that?
Yeah, let us work through the logistical details, and we'll provide the script to you when that particular item has been settled. At this point, I really don't know how the dynamics will work. As you stated, this is the first, at least from my point of view, a joint public hearing. So that will be a different way to manage the script. So, but we'll get to that point, obviously prior to the public hearing.
Okay. Very good. Let's go to item 7D, setting a public hearing on Development Code Docket Item CR5, Places of Worship Code Amendment.
Yeah, Commissioners, you received a briefing last week, that was December 1st, 2022, related to the Development Code Docket CR5, which is the Places of Worship Code Amendment. During the conversation, the staff provided you with the background related to the Planning Commission actions in the public hearings. The Planning Commission held on November 3rd, 2021. And they provided 3 particular options, and the board decided at that time to move ahead with a public hearing that includes the Planning Commission recommendations only, not to include the other options. So this particular item is to set the public hearing for January 11, 2022 at 3 in the afternoon, where you will be receiving public testimony related to this item. Maya Tipo, staff member, presented the items, working these items here to answer any clarifying questions.
Commissioner Mejia,
No, sir.
Commissioner Edwards.
No question.
Is January 11th an important day of some kind for having this hearing?
No, we can push it back if that's the commissioner's wishes.
It's just a Board of Health day is the only thing, and it's we can do it if there was a need to, but sometimes it's kind of hard to squeeze them in and get Board of Health in, and it's just a thought, but I think it's good. Something to keep in mind. We shouldn't be loading public hearings on the Board of Health Tuesdays as a general thing, but probably squeeze this one. Probably is not going to draw a ton of comment, but who knows?
No, I appreciate that perspective. We can certainly move 1 week just to make sure that we avoid any conflicts. Yeah.
Okay, very good. Let's look at item 8A, information technology, contract with interpersonal frequency for web content management.
Yeah, thank you, Commissioners. This particular item is related to the web design services for the county. Back in August 2019, the Board of County Commissioners approved to go through a request for proposals to secure the services of the vendor. They will help us to upgrade and update our web presence across the county. For so many different reasons, we just, the pandemic and everything else, we just didn't have the opportunity to move forward with this particular contract. Also, during the conversation, you agreed to include these portions to be funded by the ARPA funds. That was a decision the board made. So here we are, is for you to consider awarding the contract to interpersonal frequency web content management system. And again, this will be to help us update and upgrade our web site in our web presence. And also will allow us to really bring the whole web site of the county to the 21st century. That's my 2 cents, editorial 2 cents. Dennis is here as well as Megan Porter. Both have been working this particular contract and this particular process, and they are available to answer any questions.
Commissioner Mejia?
Was this an RFP that went out?
In 2018. No, sorry, 2019, August 6, 2019.
We were just on the verge of awarding it when COVID hit.
Okay.
Commissioner Edwards?
Yes, sir. So we're planning on spending $664,000, but that's for the first 2 years. Is that what I'm hearing here?
The duration of the contracts for 2 years. Go ahead.
I could answer that. I'm sorry. We did Dennis Osorio, IT director. We did update the action, so it will be updated for next Tuesday. The implementation costs are $484,738, and that includes licensing costs for 1 year. The ongoing cost will be $119,246. We're not asking for the 2 years. We're just asking for 1 year, and then we'll renew every year after that. But we are asking for a 20% contingency to be added to the $484,738 for a total of $581,685. And the reason for this is because of the nature of this project. We expect a significant amount of change requests as we'll be replacing all of the county's websites. So there will be a lot of, there may be some unidentified changes that we wanted to go through. So we wanted to up the contingency a bit to give us some wiggle room with that. So we will be updating the action. It's actually already updated, but you'll be getting a new action next week. Sorry about the confusion.
And once this is implemented, is it's a product that's done at the point of implementation? I mean, have they worked all the bugs out and everything's ready to go now as soon as we do the contract?
That is correct, Commissioner. Once implementation is done, as I stated, there'll be 119,000 on ongoing cost, and that will be our hosting, some of the licensing products that we'll be using from interfrequency. That will be the ongoing cost. But yes, once implementation is done, and it's currently slotted to this project is slotted to kick off February, and it should take 1 year. That is our current estimates.
Is
Sure,
that gonna be?
Oh, sorry.
Oh.
No, go ahead, Commissioner Edwards. I didn't know. Keep going.
Is that gonna be the cloud storage and the whole web presence? Is it everything?
Yes, this will be hosted in AWS. It will be hosted in the cloud.
It is hosted in the cloud, but this is not what we've been talking about, moving everything to the cloud. This is just our website.
Okay, I guess I want to listen to my seatmate because I know she knows more about it than I do. So go ahead.
My question, so what's the timeline for this once we sign the contract?
Project kickoff is in February of 2022, 1 year.
Okay, and so for 1 year, we're going to be updating all of our websites, right? So my question is, with that licensing that we're going to be paying and that's covered for the first year, are we going to start paying for that February 2022, or is that going to start after basically everything is already implemented and set in place?
The licensing payments will start normally they start after implementation costs. I mean, after implementation is completed. So currently we're scheduled for 1 year. Everyone knows sometimes projects go longer. So we wouldn't start paying a second year, I don't believe, until we're live from implementation.
Okay, so
Sorry,
this covers 2 years because one of them is covered, you said, with the 484, and then we're also going to be paying for 119. So that's 2 years that we're paying for licensing costs. Do I have that correct?
Yes, but we wouldn't pay that 119 until the second year. That's why I said this current action. The current one that you have is worded a little incorrect, and I'm sorry about that. We did word one that's a little bit clearer that you'll be getting a new copy of. So we won't be looking at that 119 because that will already be we'll already start collecting that in rates. We're just looking at implementation of the project. That's what we're seeking approval for.
So the only figure we're looking at for this one is the 484.
That is correct, with the 20% contingency though.
Contract, though, for the second year, they need to have a contract in place. This isn't budget, this is contract.
We have the option every year to renew the contract.
So you're going to bring the contract back to the board every year?
That is how interpersonal frequency does their contracting. So
Okay.
Yes, so we do some of that with Microsoft as well. We bring our Microsoft licensing when it renews back to the board.
And I think Commissioner Mejia had a good question. I'm sorry.
Go ahead.
In terms of on the numbers, one thing is the cost of implementation. The implementation is going to start from February 2022 and will fully implemented by February 2023. But also you're requesting for the first year of the license payment in 2023 for $119,246. Is that correct?
That's what this motion says, and I'm hearing him say he's got a different motion that takes out the second year.
Let me throw
That's why we're confused.
So, and once again, I do apologize. We normally do not bring these projects forward and ask for every year of licensing going forward. That has not been the standard. The 484,000 is all of implementation for the project as well as licensing of that year.
So I have another question. Dennis, you said that instead of the 10%, you were requesting a 20% contingency, and I have a question for Ramiro and Robin, if that's, because I know in other motions where we've considered that, you've said no, 10 is.
We have 10% cap in our policy.
On the procurement policy.
Is this different then?
Well, the board certainly can deviate from that because
It's your policy.
it's your policy.
But we do that so that if there are changes above 10%, the board is aware. Okay.
Because for instance, a 20% of $500,000 is significant, right? So, and when we drafted that policy to put a cap of 10% for the board to consider, if something deviates beyond the 10%, we need to come back to you.
Right.
Give you the explanation as to why the deviation beyond the 10%. But notwithstanding, you have the option to go beyond that 10% cap, absolutely.
And we are more than open to doing that. I mean, we just discussed pretty extensively about this specific project having a significant amount of change requests because of the visibility and everyone going to a new website. We can just put in 10%, and if it's above that, we have no problem bringing the additional back to the board.
My question, Rob, is I think for Robin, is the $119,000 of ongoing costs built into our financial model? Because there's going to be a limit to what ARPA can cover.
So that's a good question for Dennis. Did we build this in, or did we only put in the implementation?
No, we did. We built this in the rates.
There you go.
Yes.
Perfect. Okay.
I do have another question.
Yeah. Go back to Commissioner Edwardson.
So I'm hearing this is a incremental implementation. It's, well, we're talking about it's going to take a year to get implementation in place. So we're doing one group and then another group and another group. Is that what we're doing?
We'll be working with the vendor for the project plan, so that would come forward. And normally I would imagine they would be doing probably office and department at a time, broken up in some time so everyone's not linked to each other.
But we're paying for the full licensing fee for a group that is not getting any service initially? They might not get their implementation put in 6 months later or something. That's what I'm wondering about.
Yeah, often with specifically software, as soon as you stand up cloud services, you start paying those costs because you're using the licensing even before it's completely live. This is specifically around cloud services because they're hosted.
This is what we're finding as we do the large system changes.
We have a very similar model happening with the ERP project. They're having to pay licensing cost immediately.
Because it will be extremely tasking just to have a system and just plug it for everybody to join. I think incremental changes is what we need, is the more practical way to do it. And that's how the ERP is going through.
Who's the beneficiary on this whole implementation? Is it the citizen that wants to review what their government is doing?
I think it's both the citizen and the
people using it.
and the people who
So,
are have
so
County
let me-
benefits, but
A practical example, if I may. We're in the process of upgrading the Amanda system, the permitting system.
Yes, I knew that.
And the permitting system, really the new system, will be purely web-based. So any citizen can process a permit using a web environment on the Amanda system. The current web page that we have doesn't allow to do that. So we need to upgrade this, what we call the portal, to allow all the new system to be workable within that. Because the Amanda system, the replacement of it, if we don't have a good portal, a new web system, it will be continue to struggle to provide the services to the citizens. So the answer is correct. To a great extent is obviously to the benefit of the citizens. It also internally will allow us to manage the whole services that we provide in a more efficient way.
When this is,
I'm just going to jump in. I apologize for interrupting, but I want to be clear that it's that availability for e-commerce for our citizens and their ability to access their government through the web service that has enabled us to say it's eligible for ARPA. So it is definitely a benefit to the citizen so that they are not exposed by having to come to the county courthouse.
So we were able to pay for this out of ARPA funds?
Exactly.
Why didn't you tell me that earlier?
So we're carefully characterizing what the
Okay.
benefit is.
Okay, then one final question. We're gonna have a new web page for the county when this is done.
All the web pages.
Yeah, I mean, so from what it is today to what it's gonna be a year from now, when somebody signs on, it becomes a easier process for them to maneuver through the system, is that it?
Yep.
Yep.
Okay, then my follow-up question to that is, if we go to this, I mean, it sounds like we're going through this process and gonna finally get to that end product. When a citizen wants to review, I'm just gonna say the minutes of a particular meeting that we as county commissioners did under the open public meetings requirements where we have to have minutes. So the citizen will be able to click into the commissioner's office, for an example, want to look at a meeting we talked about water quality or whatever it was. As long as they know the date, I guess, they can just talk water quality on June 2nd or whatever it was. And then they get to view either the YouTube possibly, or maybe review the minutes of that particular meeting. And therein brings the problem to, do we have the logistics to fill in that void that currently is apparently not there quite often. I hear that people try to look things up, but it's not there. Might say we had a meeting, but we don't have minutes or something. So are we gonna be current from that point on? Is this gonna make it so we're gonna be more effective for the citizens to look at what we're doing? Is that what I'm hearing?
That is one component. That's not necessarily the driving force of this webpage. We have minutes available to any citizen who requests, and we'll make those available upon request. So,
Well, no, I don't know if citizens ought to have to ask for anything. I think everything we do should be available to them, so they could just come and look. I don't have anything to keep, I want to make sure, as current as possible, we can have all our information available to citizens that are interested.
certainly that will be one of the benefits.
Okay. My next question was gonna be the funding and the 60/40 current expense, not current expense, but you've covered that. Thank you very much.
That will be on the ongoing.
On the ongoing cost, right, will
For
be
the
the
license.
60/40
But
split.
that implementation, that $500,000 to implement it, that's gonna be paid for
Right,
ARPA.
good, okay, you got it. You got me in the game right now. Good, thank you. Thanks, Dennis.
Once again, I'm very sorry for the confusion on the action. I just one clarification before we go on. Would you like me to limit it to 10% and come back if there's change requests higher than that?
Yes,
For the-
please.
Okay, no problem.
All right, thank you, Dennis. Let's go to item 9A, Public Health and Social Services, Choice Youth Marijuana Prevention Education Contract Amendment number 6.
So when I was reviewing this item, I believe I understand the purpose of this item is to add additional funding to the current contract that we have with Choice to provide a youth marijuana prevention education program. And I believe there is adding $25,000 to the contract for a total of $93,000. So avoiding running the risk of presenting an item that I don't quite get it, Chris Hawkins is here to present this item.
Good morning, Commissioners. Chris Hawkins, Program Manager on Education Prevention at Thurston County Public Health and Social Services. Yes, this is a contract amendment, as County Manager Chavez correctly characterized it, for the current state fiscal year, original source is Department of Health funding, but the regional lead for the Cascade Pacific Action Alliance region on youth marijuana prevention education is Choice Regional Health Network. And so they then subcontract with the counties in that multi-county area. And we're one of the counties that carries out prevention education on youth substance use. So we're a natural partner for Choice to carry this out within our community. It consists of a variety of different activities and efforts to educate about the impacts and harms of marijuana use on young people. And we do that through collaborative efforts with community organizations by assessing the local environment to see if there are changes to environment or policy that we can make that will sort of steer youth to not utilize marijuana, provide them with healthier alternatives, and to convey that information and messages to key leaders in the community, among those you as the Board of Health, as well as people within the school systems and other influential organizations in Thurston County, so that they understand what those harms are to the developing minds of our young people from substance use, and in this case, specifically marijuana. So we get a subcontract each year for $25,000 from Choice as the regional lead, and are able to participate in getting the word out here in Thurston County. So we're requesting that you approve the contract amendment for 21-22 in the amount of $25,000 added to this ongoing contract.
Questions from the board?
I do have questions.
Go ahead, sir.
Is this pass-through money?
In the sense that, yes, it is originally state funding. The State Department of Health originally is the source for this youth marijuana education effort. They then subcontract to a regional lead in each accountable community of health region in Washington State. And that's the Cascade Pacific Action Alliance here in our part of the state. And that is, again, Choice Regional Health Network is the lead entity on that. So they pass through to the local health departments, I think is mostly who they have as subcontractors to carry out this work within counties.
And then my follow-up to that is it limited to marijuana education, I guess? I mean, I'm a little more concerned about fentanyl, probably, and alcohol, I guess.
Yeah. Very good question. And yes, it does. It is very specific to marijuana. However, that does connect to various efforts that we make as a health department on opioid reduction, as well as prevention of youth substance use more broadly. We have a couple of coalitions that we support here in Thurston County that are working on a broad array of alcohol, tobacco, and other drugs, and trying to prevent and promote healthier behaviors, and work with our local communities to accomplish that. So we braid this with other things that we do so as to address the wider range of youth substance use. An example of that being vaping is one of the key ways that marijuana is delivered to people in our community, and that happens to be a fairly substantial problem among young people going down into the middle school level. And so that shows up in our data. So we can work on vaping prevention because it connects to how marijuana is used by young people and others in our community. And so we are able to kind of link those efforts and amplify what we do.
Okay, thank you.
Yep. And this, of course, connects to county strategic plans regarding public health, of improving health outcomes for all people and improving community health and wellness. So we're eager to continue the work.
Anything else, Commissioner Mejia?
No, sir.
Okay, thanks, Chris.
Thank you.
Let's go to item 10A, which is a public works item, project prospectus and local agency agreement for Johnson Point, Hawks Prairie intersection improvement project.
Yeah, thank you, Commissioner. The Public Works Department has been awarded a grant of $2,966,673. And the source of funding is the Federal Highway Administration, the Surface Transportation Block Grant. And this particular grant will fund the activities related to the right-of-way acquisition and construction of the Johnson Point Road and Hawkesbury Road intersection. Currently is a unsignalized stop intersection, and the proposed improvements will be to build a roundabout at this particular location. This particular grant requires a match of 13.5%, and that is already included on the county road fund, and the proposed TIP will be approved here in the next couple of weeks, next week. So as part of the process to secure the grant, we need to sign what we call is a project prospectus with the local agency agreement with the State Department of Transportation. So this particular request is for you to authorize the Director of Public Works to sign this local agency agreement so we can secure the grant from the Federal Highway Administration. Brian Blazer from Public Works is here to answer any questions or add additional perspective.
Questions, Commissioner Mejia?
No, sir.
Commissioner Edwards?
No, thanks for doing the work. It sounds like that'll be a good project when it's done, though. Thanks for finding the money to do it.
Thank you.
Okay, thanks, Ryan.
Thanks.
We've hit our halfway point, so we're going to call for a break. We still have 6 business items left on this extremely lengthy agenda, and then we've got Board of Health, and we'll go from there. But we'll pick up with item 10B in about, let's say, 15 minutes, 10:40. Okay, good morning, 10:46 a.m. We're picking back up in this Thurston County Board of County Commissioners agenda setting work session for December 7th, picking back up in the middle of item 4. We are up to item 10B on the proposed agenda for December 14th. And that item is a resolution to apply for a grant from the Brian Abbott Fish Barrier Removal Board to support Country Club Road Northwest at Green Cove Creek culvert replacement.
Yeah, thank you, Commissioner. And this is very timely based on this, the public feedback we have received related to this particular culvert. As you heard from the county engineer yesterday, we had to do an emergency repair with the understanding that we need to provide a final fix on the fish barrier by 2024. This particular request is for you to authorize this resolution to apply for $300,000 to help fund this particular project. And there's a little bit of an unusual set of circumstance because the Recreation and Conservation Office, which is managed by the state, requires a formal legislative action to submit for a grant. And this is really what it is. It's for you to consider passing a resolution for the department to apply for $300,000 for this culvert. Elena's here. If I have any questions.
Commissioner Mejia?
I think this is timely indeed.
Commissioner Edwards?
No, I guess I don't have anything to say about it right now. I mean, good, yeah, I'm glad they're doing it.
Is this like, so I don't recall having done this before. Is this like because we are asking for something on an emergency basis or something that we're going through this type of a process?
No, with all respect, you have approved this, and this is a requirement by RCO, where the legislative authority has to pass a resolution in order for us to apply for this funding. So the board has approved this in the past. Similar applications are related to the RCO, the Recreation and Conservation Office. So this is not related to an emergency. This is a little bit, it's very unusual for a granting agency to require a formal legislative action before we can apply. And again, the board has approved similar actions in the past.
So yesterday we were at like 7 o'clock or whatever it was, we were described that there was like 4 options being considered by Public Works, and I haven't had a chance to review any of that yet. And does this grant apply to any of those 4 options, or is this only pertain to one of the or 2 of the options?
Commissioner, this grant is for we're applying for design funds for this grant. So we are considering 4 options, but we're still going through the alternatives analysis. If we are awarded this grant, these funds would help leverage the design, permitting, cultural resource, those costs to then create a bid-ready package for construction.
So the grant isn't tied to the specifics of a particular path forward?
No.
Okay. That's Commissioner Mejia?
No, I don't have questions, sir.
No, okay, then I'm good on that one. Then why don't we keep you up, Elena, for item 10C, which is a resolution to apply for a grant from the Brian Abbott Fish Barrier Removal Board for Thompson Creek Road at Thompson Creek Fish Passage.
Similar to the previous item, Commissioner, is for you to authorize the moving forward and applying for $500,000 for, in this case, for the Thompson Creek Road on the Thompson Creek Fish Barrier Passage.
I do have a question on that.
Yes, sir.
And that's on the Skookumchuck River process, is that it?
It's on Thompson Creek, which is a tributary of the Skookumchuck. Yes, sir.
Right?
Yes, sir.
Okay.
Commissioner Mejia, anything?
No, sir.
Okay, I was going to ask the same question as Commissioner Edwards, where exactly this is. Very good. Then let's go to 10D. Request for qualification for wastewater facility planning in Grand Mound.
Yeah, thank you, Commissioners. As you know, we have a wastewater facility in the Grand Mound area, and the Grand Mound area is growing. And at this point, the wastewater treatment facility is approaching 85% of the permitted discharge, and I think it's very timely for us to secure the services of a consultant. It's going to help us go through the process and see the opportunities as to how we need to expand the capacity of the wastewater facility in Grand Mound. This is we knew this was coming because we know the amount of people is growing in the Grand Mound area, and it's just very timely to be proactive and secure the consultant services to start exploring and expanding the plan. Joe, who does here from Public Works to add additional perspective to answer any questions?
Questions for Joe?
I do have a question, but I think it's probably for Robin. Is this ARPA funds that you're gonna pay for this? I mean, we're doing sewer upgrades with ARPA funds, I thought. So why wouldn't we do ARPA funds in this category?
We chose 4 specific projects to use the ARPA money for sewer and wastewater.
What funds would normally go to this?
Normally, you would use
The Grand Mound
wastewater
utility
fund.
There's no general fund. There's the Grand Mound utility will pay for this.
How much money are we possibly talking about?
Well, that's what
This is the design process.
This is what we're trying to find out. It's a request for proposals to get the services of a consultant. So when we go through the request for proposals, we have to bring the proposed contract back to the board to approve.
Do we have money in a particular account down there then?
Yeah, the wastewater
Account?
Yeah, the utility account.
And it keeps generating money
Mhm.
and has a fund.
So we issue a bond years ago to build the infrastructure of the Grand Mound area. That bond was paid off in 2019. And now it's getting to the point of the revenues of that has put us in the position to bring this item before the board.
So we can do upgrades.
So quite often there is not enough money in these utility funds for big projects. And then the board turns to REIT 2.
Okay, well, I'm trying to not turn to REIT 2. I want to turn to ARPA funds because Congress gave us money that we could invest in sewage activity.
Yeah, but at this point, we don't know what we need to do. And that's what we're
Well, why couldn't this kind of be spent? Why can't it be spent to find out what we need to do in ARPA process?
So the item is here is the board to authorize going through a request for proposals. So at this point, we don't know how much money.
Okay, so when it comes back, we might be able to talk about ARPA funds?
They will probably see how much the services of a consultant will be, what it will be the scope of work, and then probably see the options.
I'm trying to save any of our local money that I can save.
So we can certainly discuss talking
Okay.
about paying with ARPA. Yes.
Okay, that's all I need to know.
Yep.
Thank you.
County Manager, do you have, if you don't have it handy, that's fine. We could talk after the meeting, but did this request relate to a budget decision by the board?
Is this on the CFP?
Should be the capital facilities.
Yes.
This project.
Okay, I'd like to review. There was one of these utility planning decisions that I was outvoted on, and I just, if you and I can powwow after the meeting about whether this connects to that decision that was previously made, I just need to know that.
I think it was relating to the Tamashan, wasn't that the Tamashan design?
What
I
I
think
you
they'll look
recall
at this point.
issuing $300,000 from the ARPA fund to begin the design of some of the sewer utilities. Is that you recall, Commissioner?
That's what I'm recalling, yep.
Yeah, that plan did not include this particular location.
So this is a new proposal for planning.
Yeah, which is part of the normal process included on the CIP.
Right, and I would just emphasize that this is on your CFP or CIP and planned for in the next 2 years. It's in the budget. There's budget authority provided for it because we've aligned the capital budget with the CFP.
That's the only we can touch base after the meeting, Commissioner.
Okay, yeah, I just want to make sure that I'm tracking that. Then that will go to item 10E, request for proposal, Lake Lawrence Lake Management District submerged vegetation contract.
Yeah, Commissioners, item E and F are related. One is for Lake Lawrence, and the other one is for Long Lake. And this is, the department is requesting the board to issue a request for proposals to secure the services for treatment of both lakes on the upcoming year. This is a normal process that we'll go through. I believe that both lake management districts are supportive of this process. And then when the selection of, as a result of the request for proposals are finalized, we'll come back to the board for you to consider awarding the contracts for each of the lakes. Paula Cracknell is here to answer any questions or add additional perspective.
No questions.
No question.
I do have a question. I get, so about 6 months ago, we had a Board of Health presentation, and it related to the PIVMAC, is that what it's called, and pesticide use. And there was a lot of questions from the board, and there was staff was going to do a follow-up. Basically, we were going to have a meeting with that committee because they had sent a letter with concerns about how we were doing business and that we had practices that were out of alignment with our with previous policies. And it seemed to be that we needed to either update the policies or reform the practices to conform to the policies. And that meeting never happened. And I think if it's connected to these contracts, then I'm not comfortable going forward on these contracts without knowing more, which the board was promised information months ago.
Okay. I do have a follow-up to that. My concern is that these are time issues, and if they don't get access to do the treatment in the right time frame, then there's no point in doing it. They try to do it, but it's not as effective. So I don't want to get in the way of blocking the normal process. So I think, I don't disagree, we need to maybe have a discussion on that, but this is going out for a request for proposal. So I wouldn't want to block that because that can still happen. And we can have the discussion in the meantime. If we stop this process at this point, then those folks that are trying to manage Long Lake and Lawrence Lake end up in a situation that they can't do anything for that 1 year. And I believe Long Lake especially was really kind of quite frustrated about this, but maybe Paula could straighten out what I've said. Did I hit it kinda? I mean, am I headed in the right direction with that?
You're muted, Paula.
I'm sorry. Timing is really important for managing any aquatic vegetation on lakes, absolutely, because if we have a plant that starts to come up in March or April and we wait until July to treat it, then there's no point in even going in and trying to treat the plant because we need to hit them when they're coming up in order to manage the vegetation. And as far as the IVAMP for lakes goes, that's a conversation that we started with Art and Patrick. Patrick is the director for the pesticide application protocol for Thurston County through public health. And we are planning to redesign what's written for lakes because when you have a eutrophic lake system, it's not as easy as going out on a parcel of land and treating the plant and managing it that way because it really requires constant management. Each year there's new plants that show up. We're trying to develop new strategies for managing nutrients in the lakes that we manage, because I believe that that will certainly help with the aquatic vegetation growth that we have. But when you're dealing with a eutrophic system that already has a lot of vegetation in it, and the end result of having a lot of vegetation is reduced water quality, meaning higher temperatures, lower dissolved oxygen, lower survivability for fish because of the excess vegetation, then we have a responsibility to try to improve it as much as we can by reducing the seed mass. And if we go in at the beginning of the growing season and we treat the plants, then we are effectively reducing the seed mass and reducing the spread of the plants throughout the lake. The updated IVAMP will not be done for a while. Patrick's out on leave for an unknown amount of time, and he's really the person who will move and direct this.
I also have concerns about our pesticide use in our lakes, and I know that the lake management districts are trying to do everything they can, but there's still those pretty incredible numbers that we got shown, and the concerns from PVMAC, and I'm guessing like we can go out for a request for a proposal, and when we approve the contract, maybe scheduling a work session before then so we can have a more in-depth conversation about this.
Yeah, that's a good idea.
Yeah, let me go back to public health, and I do recall that conversation, Commissioner Mensah. Let me go back to my notes as to where we left it. I know the staff who deals with all the prescriptions is been in extended medical leave, and let me know if and I'll work with Shelley before she leaves to see if there is an opportunity somebody else can help us and provide that briefing. And this related to the I believe the IPM, the prescription working group. They provided those comments to the board. So let me work on the logistics to see when that briefing can be scheduled. Shelley, like anything to add on that?
Excuse me, Commissioner, go ahead.
I was just going to follow up and say that, when I was trying to educate myself about the alum treatment issue, and then there was that kind of, at the same time, the residents got a notice about some vegetation management, and we got kind of confused. They thought we were taking action on that, but so I ended up talking to environmental health staff about the vegetation management, and there was that particular, a couple of ones that are pretty safe, and there's a couple of ones that are only safe if they can be really targeted and kept out of the water, and that's like connected to the Roundup thing and all that. And then this is submerged vegetation, which I'm imagining is a really complex thing to try to. So I'm just not sure what chemicals we're talking about and how does that connect to. I know it's not alum treatment, and I know it's not the targeted, exposed vegetation. I don't know what all goes into submerged vegetation management and how safe it is. Mm-hmm. But I don't want to be moving forward and then find out that, especially when I've had a heads up and a red flag earlier in this year that there are some disconnects between policy and practice. So I think Commissioner Edwards makes sense, and Paula, if we need to move forward on the RFPs just to keep the process moving, but as soon as possible, I'd like more information. Go ahead,
Yes.
Shelley.
Absolutely. And I do want to say that the chemicals that are written in the RFP for use are aquathol and sonar, which is fluoridone. And these are two aquatic herbicides that have been approved by the Department of Health for use in Thurston County.
Shelley, did you have something?
Thank you. I really don't have anything else to add, just that I'll work with Ramiro and our team to coordinate that briefing.
Okay, so that's 10E and F, because that's Long Lake and Lake Lawrence, same idea, I guess. Anything else to say, Ramiro, about those two?
No, sir. Thank you.
Let's go to 11A, 2021 budget amendment number 3.
Yeah, thank you, Commissioner. You got a briefing from Robin Campbell maybe over a week ago related to the budget amendment number 3. And this item is for you to consider taking a formal action and adopting amendment number 3 of the current budget, this 2021 budget. No amendments to the budget.
I do have a question on that. Is that what, okay, it's budget amendment number 3, but it's really 2 or
Yes,
4, but it's really 3?
the 3 that's actually 2. And this title should
God
say
dang
2.
it, you talk about giving me a headache. How do you do it? How do you keep that all
so
figured
sorry.
out?
We'll change, there's actually 2, you're right.
Huh?
It's actually number 2.
Okay, so I knew something was going on there. See,
It's
you
number
overload me. Okay.
Good call.
I'm just curious, I remember going through the budget amendment line by line. Were there any outstanding decision points for the board, or did we take care of all those in our briefing?
I thought that it had all been taken care of.
Okay,
Yeah,
I thought that's right, but I just couldn't remember 100% if we left anything for further
a lot of
discussion.
stuff going on, and you're right, there was no outstanding items as a result of the briefing.
No, it was actually a very conservative ask
Yeah, okay.
necessary to wrap up the year.
Okay, so after those 19 items of business are covered, we will have time maybe for the board to report on committee assignments and any community actions, issues, county manager review combined schedule, move to adjourn, and we'll have the Board of Health. The Board of Health meeting is scheduled for 3:30. It might start later based on the progression of the 2 p.m. meeting. But at some point, we will call the meeting to order and look at the agenda and meeting minutes from October 12th. There was no November Board of Health meeting. Shelley Slaughter here is our administrator.
I just don't know if I didn't get it somehow. Maybe I didn't get it. Let's see, I got it over here. This is supposed to be the same thing, but. Oh, okay. Okay.
Good to go, Commissioner?
Yeah, go ahead.
Okay. So we will look at October 12th meeting minutes. There will be a proclamation for HIV and AIDS Awareness Month. That would be to proclaim December 2021 as HIV and AIDS Awareness Month. Anything there, Shelley, we need to know?
Thank you so much, Commissioner. This is an annual proclamation that we do, and we have one of our amazing staff members here, Patrick Judkins, to add anything, but we're requesting that the Board of Health proclaim the month of December as HIV AIDS Awareness Month, and also to recognize December 1st as World AIDS Day. We have over 300 residents in Thurston County living with HIV, and we want to raise awareness about prevention, destigmatization, testing, and treatment options here in Thurston County. Patrick, is there anything that you would like to add?
We were inviting the Washington State Department of Health, their field services coordinator, Katrina Miller, to be present when the proclamation is made. And that's it. Thanks.
Anything from the board?
No, sir.
Okay. Then there'll be an opportunity for the public to address the Board of Health. And department item number 1 is emergency ordinance for Article 1 of the Thurston County Sanitary Code. Art Starry, Environmental Health Division Director. What is this all about?
Good morning. This is Art Starry. The Environmental Health Director, as Commissioner Menser indicated. And you may recall that for the past 2 years, we've been bringing emergency ordinances to the board for consideration to provide some relief and to allow us to kind of conduct business during the COVID pandemic. The one that you adopted most recently expires at the end of December. And what we wanted to do is bring before you one last resolution or ordinance, to continue to provide some services or some relief for a couple of things. And they predominantly deal with our ability to conduct hearings during the pandemic. Right now, our current ordinance that's been set aside because of the emergency ordinance or emergency actions you've taken allows us to do those things remotely or telephonically or virtually, whatever term you want to use. And we want to continue to be able to do that while the pandemic occurs. And so that's the main intent of this. There's another provision in there that allows you to take actions that last longer than emergency actions that last longer than 6 months. And so that goes hand in hand with the request. And so this would be tied then to the county's emergency declaration. So as long as that would stay in effect, our ability to conduct hearings, basically appeals hearings virtually would stay intact. And that's actually something we want to make available in our regular process, but we need to amend our administrative rules for that. And that's something we plan to bring back to you in 2022. But basically, this is just the continuation of the emergency ordinances, declarations that have been necessary in order to allow us to conduct business in environmental health for certain types of activities during the pandemic.
Questions for Art on that proposal? Commissioner Mejia, Commissioner Edwards, sorry.
No, sir. No.
Commissioner Mejia.
No.
Okay. Very good. Item 5
Thank
is Thurston. Thank you, Art. Is a Thurston Thrives update.
Thank you, Commissioner. And Chris Hawkins has joined us. He will present this item, which includes a year in review of all the great work that Thurston Thrives Coordinating Council, as well as all the action teams, have accomplished. Chris?
Yes, good morning, Commissioners. Chris Hawkins, Program Manager on Education and Prevention for Thurston County Public Health and Social Services. And this will be a presentation that probably those of you who've been involved and active with Thurston Thrives Coordinating Council or on an action team, which I know a couple of you commissioners are, you'll know what's coming. It's basically a summary of project efforts and strategies that the Thurston Thrives has been active on in this past year. And it won't be just me. We've invited the Thurston County Chamber Foundation from a couple of representatives from that organization, Jessica Houchin and Megan Feast, to present this item with me. I will just be focusing on a couple of action areas that I've been deeply involved with. But it will include a summary of the racial equity area of focus for Thurston Thrives this past year, the overall effort to address social determinants of health and what that means through collective impact approach and sort of this public-private partnership that the Thurston Thrives has been active in leading throughout this last few years. So that's it, and there'll be an opportunity to address some of the specifics of the different action teams and what they've been accomplishing this past year as well. So yeah, that will be a nice, well-rounded presentation, and looking forward to being able to be a part of that with you. Any questions?
Questions for Chris from the board, Commissioner Edwards?
No, no questions, sir.
Commissioner Mejia?
I just have a couple comments about maybe the future of Thurston Thrives and where we're going to go from here. And Chris, you were a part of the conversation where kind of we had this conversation in the Thurston Thrives Coordinating Council where we were all divided. And I was in a group with elected officials on kind of, okay, what should we start, stop, or continue doing? And the overall consensus of all the different stakeholders was, we don't know what we're doing. So how can we start, how can we continue something where we don't know what we're doing? And I had this conversation with Megan Feast from the Chamber, because that's been kind of my overall sense this whole year. And it was kind of, I guess, nice to see I wasn't the only one that had that overall sense as well. And so from what I heard from Megan, they were planning to restructure, but I believe that's a conversation we need to have, because where do we go from here? And, what are we doing? So I just kind of wanted, because I thought it was a really good conversation. And Ramiro has his hand up.
So does Edwards.
Okay, go ahead, County Manager, and then we'll go.
No, you go ahead, go ahead. I got it up second after you.
Commissioner Mejia, that's a very good question. And in fact, the Executive Committee of Thurston Thrives have been meeting and trying to work through what really, what the next steps, what will be the future of Thurston Thrives. And in fact, this Friday, we have a workshop, the Executive Committee of Thurston Thrives. I'm part of that, to really start talking about that. What will be the structure? What will be the next steps? So hopefully through that conversation, something will come back to the original, the whole council for consideration. But it is something that the executive committee is aware. Hopefully we can get through this process to determine what will be the next steps for Thurston Thrives as a whole. You'd like to add anything else, Shelley, since you're part of the executive committee as well?
Thank you, Ramiro. Yes, and I just want to say that there's the future and governance of the Thurston Thrives Coordinating Council, but overall for Thurston Thrives, this has been a really essential and successful collective impact effort to improve our community's health that was started by our Board of Health and supported by our staff and many, many community members who come together to improve the social determinants of health in our community. And we have moved the needle on health and been nationally recognized for this work. And I think that while there's definitely changes ahead and any effort like this needs to be adapted as the needs of our community change, I think that the work that the teams, which are the heart of what Thurston Thrives has done fabulous work. And I'm looking forward to this year-end report and the ongoing future of Thurston Thrives.
Okay, good questions. Maybe Willie can take that up a little bit on Tuesday.
Commissioner Edwards, comment.
Oh yeah, Commissioner Edwards.
I guess I just want to give Commissioner Mejia some support on her feeling of maybe a frustration with what goes on and what's next, because as the longest serving member on this board and having been there with the folks from Together, I have no doubt that all participants have the best of intentions, but this frustration has been building for quite some period of time about what are the real accomplishments and what do we need to do. So you're not alone on that feeling. I just wanted to let you know that. So
yeah, well, that's good to know.
More to come sometime in the near future.
Yeah, that's what I'm hearing.
Okay, good enough. Thank you.
Okay, next item is wintertime safety.
Chris Hawkins will also be helping to support this item, as well as Sammy Berg from Food and Environmental Services. And I think that's why Art probably just turned on his screen to help out with this particular item. We wanted to focus on wintertime health and safety to cover a variety of topics, including safe food preparation, emergency preparedness, safe driving. December is also Impaired Driving Awareness Month. We want to prevent people from drinking and driving and prevent accidents and make sure that as this time of year, many people gather together with family and friends, that they do so safely. Chris or Art, anything that you would like to add about this presentation item?
Well, this is Art. I think you covered it correctly, Shelley. I know, and Chris and Sammy are putting together the presentation, and should have something exciting come next week, next Tuesday.
Anything from the board?
No, sir.
Yes.
Go ahead, Commissioner.
I don't know exactly what you're going to cover. I'm sure it'll be interesting, but I guess my concern is we don't seem to be talking ever about wellness and how to have better health outcomes. And I guess I'm going to gear it specifically to what we're facing with this virus, where the healthier people are, the better their resistance is to illness, including the vaccination that you want to cover. But I mean, there's overall wellness that is a benefit too. If you look at all the underlying factors of people that are having trouble when they come down with this virus. So how come we don't talk about, we didn't wash your hands or something, that was all part of the whole thing early, but why not keep your immunity up? What keeps your immunity up? I don't know, is it eating dirt, or is it, eating berries instead of ice cream? I don't know the answer to that, but there must be some ongoing health issues. I don't know. I make an elderberry juice every year because I'm told there's a lot of antioxidants in elderberry. I don't know if it works or not, but I've been told that it's beneficial. Do we ever talk about beneficial health issues like that? I mean, it seems like we've gotten away from all that with this virus. Get a shot and it'll take care of it. But then we find out it really doesn't take care of it, but it does help your outcome if you come down with the virus. But I'd rather not get the darn thing. And I think a lot of people feel that same way, that they don't want to get it either. Is resistance, we used to talk about resistance to illness. We don't seem to talk about that anymore. Whether that's taking vitamins or supplements or eating properly. Or am I just too old?
I don't know if Art or Shelley want to launch in on this, but certainly preventive behaviors that do keep your immune system well tuned include some things that you've mentioned: healthy eating, remaining physically active, and one of the things that we'll cover in this presentation will be about washing hands. That's a pretty basic one that is effective for a lot of different prevention and keeping your body so that it is not overwhelmed by infective pathogens. So those are just a few things that come to mind, and there will be some of that that's addressed in this presentation. But when you're talking about prevention, it's really about trying to create the supportive environment, including putting out messages about ways that people can keep themselves healthy, because you want to kind of promote the things that do contribute to better health on the part of the population, rather than force people down the line through rules and regulations, ideally. But yeah, that's just a couple of thoughts on that.
Okay, thank you. Sounds good.
And I just want to add that that is a very important part of our mission at Thurston County Public Health and Social Services. Chris's entire program is dedicated to that. And what we were just talking about before about social determinants of health and Thurston Thrives, all is about promoting wellness and health prevention and promotion. And Chris's group focuses on chronic disease prevention, healthy eating, having an active lifestyle, all those things that can prevent underlying conditions that we've seen contribute to poor health outcomes and death and COVID, and especially addressing health inequities and disparities. So those are all things that are really important and definitely work that we have continued throughout this pandemic. And happy to, while I won't be here, suggest for a future agenda topic that we focus and emphasize and have a presentation about that. So thank you for that question, Commissioner Edwards, and put that forward to action.
Thank you.
Okay. Board of Health members will have a chance to give reports. Health officer will give a report. Shelley, you'll have a chance to give a report. I'm not sure what you got lined up for your report, but I'd like to make a request. Since this will be our last director's report from you, if you could, I'm getting nervous that we're about 6 months away from having to seat a expanded Board of Health. And I know there's a lot of pieces. So if you could kind of outline where we are on that and what's next, and kind of what you would recommend we be doing over the next 6 months to get that in place? I mean, just for example, with the municipal seat, I know that, and then the selection of the 3 buckets. I know there's a tribal rep coming. I've proposed the board's proposal to the municipal leaders who are all very enthusiastic about that, but I know there's got to be probably some kind of resolution or documentation in terms of how we specifically expand and then seat these members and then get them oriented. I feel like there's a lot to be done between now and that first meeting in July where we're going to have an expanded Board of Health. So if you could kind of outline the path forward, I'd appreciate that in your director's report.
Yes, I will, sir. Thank you so much.
Okay. Anything else for Shelley or anything else regarding to the Board of Health meeting?
No, sir.
Okay. Thanks, Shelley. All right. Well, that covers item 5. And now let's look at item 6, proclamations and awards.
Good morning, Amy Davis, clerk of the board. There are no proclamations for review this morning.
Perfect. Item 7 is advisory boards and commissions.
Last week, you held interviews for the vacant Timberland Regional Library seat and met with Carly Schiffner and Mary Beth Harrington. They were both delighted to have the opportunity to interview for the seat and have shared their thanks for your time that day. There was a question of when Nicolette Oliver's term ends, and that is December 31st, 2026. So this item is here for your discussion, and I'm happy to inform them of any direction received.
Okay. Commissioners got their coins out? Or?
Decision comes.
I'm just kidding.
Very good candidates, and is I believe a good position to be in because you have a very good, strong candidates. I don't think the decision the board will make. I think it will be good no matter what it is.
Anybody want to jump in with thoughts on this? I'm willing to start. Go ahead, Commissioner Mejia.
I guess I'll start. Yeah, I mean, I was so impressed by them, and I felt the same way. Commissioner Menser made a funny remark at the end. He was like, I thought it was going to be easier after the interview, and now it's now harder. So I had the same sentiment about this. I was so impressed by both of them. I think they both bring just different assets to the regional library. Just, with Carly, her experience, I think just both as a staff member of a previous board and as a board member and other organizations herself, I feel like just that experience is it's very useful because I know the Timberland Regional Library has had issues with that specific things before. And then with Mary Beth, just her business outlook that she brings into the library, and with just all her previous experiences with libraries. I think what kind of, I went back and watched the video this weekend and kind of, I was able to catch something that I wasn't able to catch, during the interview, and that was kind of the future of the library. That was Commissioner Menser's question, I believe, where they saw kind of the future of the library, and I think that's kind of what honed it down for me. I know the libraries are currently not in a, Timberland Library is not in a, fantastic financial place right now. I think they're struggling just like every other library across the nation. And so with that, and just hearing both of their explanations, I think my choice currently, I guess, is Mary Beth, just because of the future of libraries and some of the very hard decisions, and with her having that business experience, I think will be very fruitful. So with that, yeah, I mean, this wasn't, I think we'll be lucky with either of them. So I'm not sure kind of a long explanation for where I kind of wanted to get that.
Commissioner Edwards?
I guess, yeah, they were both excellent candidates, no doubt about that. I guess, I believe, I like Mary Beth's explanation from a business standpoint, even of the potholes in the road that she referred to coming up here from Texas, that we had better roads here, realizing, but we had to pay for those. So, I think from a business perspective, she's got something to add. So that's kind of where
All right, well, it sounds like we're on the same page. I really struggled, went back and forth, but I think ultimately, because this board has had a little bit of discord, I kind of liked Mary Beth's kind of no-nonsense business background and just a wealth of experience in large library systems. I just think that she's going to bring a skill set that maybe is the right time in the right place right now for our library board. So I'm gonna concur with my seatmates.
So we'll bring the appointment is Mary Beth Harrington for your consideration next Tuesday.
Okay.
Thank you to Carly, because I thought she was very exceptional too. And I mean, this wasn't easy for me. I don't think it was easy for any of us. So just a thank you, and I'm not sure if there's a possibility to see if she's interested in other boards. I mean, I think just with her wealth of knowledge, it would behoove us not to have her in one of our advisory boards.
Well, yeah, I mean, and we've had in the time that I've been on the board, we've had at least one, if not two, folks step down from the library board. So, I mean, you never know what's going to happen. There's always vacancies that come up you're not anticipating, and I think we know where we can look if we need some to tap somebody for a vacancy. So, good to have that perspective, and I'm glad we went through the process of speaking with both. Okay, let's go to. Oh no, we've got more here. So go ahead, Amy. What's
Thank you. So Glenn Shorno would like to resubmit his application for the Agriculture Advisory Committee. There is one vacant farmer seat for a 2-year term. If you'd like to review his application, we can circle back next Tuesday morning and perhaps include on the agenda of the 14th, if that's the direction you'd like to go.
Can you remind me of, when he applied before, there was 2 people for 1 seat. What seat is now available?
Richard McMyers.
Oh, okay, so he's applying for that seat. Okay,
Yes.
gotcha. Go ahead, Commissioner Mejia.
This committee, it seems like there's some things going on right now in this committee again, and I don't know where my seatmates are, but I would prefer for us to get the handbook and have them all review and sign it before we appoint anyone to it. And I hope Mr. Shorno will be patient with us, but I feel like just from the emails we've been receiving, I feel it's best that we wait until, I don't know,
County Manager, what is the timeline for our committee handbook?
I just had a conversation with Amy. I believe there was a one question that we need to work with Elizabeth. The handbook itself is completed. We have received all the comments so far. So the book itself is ready. The only question that remaining is what boards and committees the board would like to ask to follow OPMA.
I thought we decided to do all of them.
Well, I don't think that it was a unanimous decision that all of us should follow, but if that is the direction, that's.
I thought it was. I thought we all just agreed to have, from my previous recollection of the conversation, is we all agreed for OPMA. I think there was really no, just so they would all be on the same.
Let me ask a question about that. Do you have some hesitancy because some of the boards that we oversee, would there ever be a reason that they should do something, I don't know, behind closed doors or something? I mean, I'm just trying to think of the 40 boards or whatever. Is it not gonna be applicable to all of them because of X, and I don't know what X is, but, why wouldn't we want them all to follow the same?
I really don't have a concern.
Okay,
I don't have anything. And I just go back to my notes that I don't think it was a unanimous decision. But if I missed my notes, certainly if you want to provide guidance today, that you would like to recommend all boards and commissions to follow OPMA, we'll bring an item for your consideration that will outline that in approving the handbook.
And I guess my question is, I know that this particular board, there was some guidance given to them that they did not have to do OPMA, and then some guidance that they did have to do OPMA, I guess, maybe that came from the board, I don't know. Some came from an attorney, some came from the board, and the ultimate outcome, why not do OPMA, I guess. But why wouldn't we do it with all of them? I don't know, I'm not remembering any hesitancy.
Well, again, certainly my notes always be wrong, but I just want to be respectful of that. But if that is the direction the board will bring an item.
Miro, your audio is really bad. I can't really hear what you're saying in
My
particular.
apologies. Can you hear me better right now?
A little bit.
Okay. So I don't know if
I think I caught what you're saying. I don't recall the discussion saying that we wanted every board to be OPMA, and I could be wrong because my memory's not awesome, but I feel like I would have wanted, and sitting here today, I feel like I'd want a little bit of guidance from council about that, like I'd like to know which ones need to be by law, and then we could decide if we want to expand it beyond that category. I'm not I don't know, and I don't know how burdensome OPMA is to a small committee. That's my only concern. It's like OPMA is about open government, and obviously we're the county commission. Everything we do is subject to it. There are certain committees that are so closely connected to government function that they need to be part of that. But as you get further and further away, I don't necessarily think that the whole world needs to be subject to OPMA. So, and if it's burdensome and for our volunteers to have to notice up meetings in a certain way when they're really not legally subject to it, I'm not necessarily inclined to just say everybody's got to do it. I'm open to hearing that argument, but I don't know that I've made that decision for myself. And I feel like I would have wanted to hear from council who has to do it by the nature of the scope of the law. And then who would be up to the board to say we'd like to expand it. I'd like to kind of understand those two buckets before I made a final decision myself.
So I believe we discussed about the ones that are on at the planning session, and so with my recollection is we discussed this, and I have a different recollection, but then you and Miro, and I might be wrong too. But I think that was kind of the direction when we told Amy to go ahead with the handbook, is kind of under the guidance that, basically everyone would be under OPMA.
Okay, well, that's possible. Going back to your original point, Commissioner, I think it's a pretty good idea to have our Agricultural Advisory Committee sign off on this handbook. Because I'm hearing the same elements of problems with process. They seem to really get along and have excellent conversations about the substance of the policies. They seem to hit stumbles in their way of process and how they go about doing things. And that's frustrating because I think there's a lot of good members on there with a lot of knowledge. They just need to operate in a really, they need to operate in a agreed upon fashion.
I'm not sure you can change the personality. That's just.
But certainly the handbook, I think, can be beneficial to not just this committee, but many others. Because the Roberts rules is probably what provides a a structured conversation that perhaps leads to a civil agreements or disagreements within that conversation. And I think some of the boards and commissions certainly need them. And having signing to a handbook, I think is a good step moving forward.
Is everybody going off?
Yeah, it's an Amber Alert on all of our phones.
Well, does the quiet setting not work when it's on, when it does an Amber Alert?
I have myself in silent mode.
Mine's buzzing like crazy though.
Vibrates.
Okay, I guess, well, maybe I didn't have them right. Maybe. Scared me half to death.
I know. I was getting ready to exit the building.
There's an earthquake. Or a tidal wave.
In our, okay, so back to OPMA. According to the MRSC, here's who is required to comply with OPMA. Governing body, a sub-agency created by an ordinance or legislative act, such as the Planning Commission, the Library Board, Parks Board, Civil Service Commission, and committees that act on behalf of exercising actual or de facto decision-making authority for the governing body if they conduct hearings or take testimony or public comment. The only committee that does not have to comply with OPMA is purely advisory.
Audio's gotten really, really bad.
Oh, okay. So sorry. This is who has to comply. Governing body, sub-agencies that are created by ordinance or a legislative act, and that includes committees, and committees that act on behalf of the governing body. So they exercise actual or de facto decision-making, take testimony or public comment, or conduct hearings. The only committee that does not have to comply are committees that are purely advisory.
So
Otherwise, all
can you go back to the second one?
created by ordinance or legislative act.
How many of those do we have?
That's a good
Ag,
question.
I know ag is in there.
Yep. Ag,
So
yeah.
why would they ever have been told they don't have to get an OPMA when clearly that would say they do?
I don't know who would have told them that or why they would have heard that,
It was-
but I would say they definitely
An old attorney opinion, it's gone back and forth. I mean, there's been so many.
That's pretty broad.
Yeah.
That's gonna cover a lot of our committees,
the vast majority.
although, not advisory, purely advisory, we have a lot of purely advisory
You're
committees.
all kind of
But the question is
advisory.
whether whether they're in our code.
If they conduct hearings or take public comment or testimony, they have to comply with the OPMA.
Well, what I think is for the committees the reverse, for instance, they necessarily take public testimony, or the public testimony is somewhat of an ad hoc. Based on my experience that I've seen, by putting an OPMA, then they will be required to take public testimony. That's a little bit of the reverse based on what I'm hearing. But every single committee that you have approved has been by a legislative action. The board has created those committees. So that means one of the criteria.
Kind of what you're just making them all. If 80% of them are gonna be by law, then why not just make them all? So it's consistent and simple, I guess, is part of the argument.
So
I think so there's not this confusion, because I've seen it somehow, they're so confused on what they're supposed to be following. And I feel like this would just provide consistency to all of them on like, okay, this is it, like,
Here's the rules.
here's your rules. Instead of,
Make the handbook simpler and more universally applicable if it's just the same process.
So if that is the direction that, it's pretty simple, we'll bring another item for next week's agenda. they will adopt the handbook and also provide direction. All boards and commissions will be subject to OPMA, and they will be required to follow the handbook.
I'd even refer to the RCW that Robin's referring to, I think, in there. As per RCW.
You're a legislative body. You can.
I know, but in following RCW sections.
Because in some cases, some of the RCW may not apply to some boards and commissions.
Oh, you think so?
So if you take a legislative action that's intended to do,
okay.
it will create that environment.
Okay, so then there's another applicant, so we can pick up maybe ad committee next week or whatever, revisit that.
Okay.
Let's talk about the next one.
Yeah, so I've received a notification from the Hotel Motel Commission for their nomination of Brian Powell of the Lacey Holiday Inn Express to be appointed to the Hotel Motel Commission. And a reminder that these appointments are made in the individual's name, not the business name. And also, Robin, please correct me if I'm wrong, it is in our contract with the TPA that the board shall appoint any individuals nominated by the TPA Commission.
This came from the TPA Commission?
Yes.
Okay.
So it's here for your
Easy
review.
peasy.
We'll include this on next week's agenda.
Questions on that one? No. Okay, and now it will take us to PIO check-in. I see Megan's up there. I'm just kidding.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. Excuse me. Just a couple of updates for you this morning. So because of staffing and the holiday schedule, last Friday was the last Friday 5 for the year. The next Friday 5 will come out January 7th. We'll still be using our social media to provide any updates that we need to provide, but there will not be a Friday 5. And I've been working with the designers on the atrium for the BoCC office design. You should have all received a copy of that on your desks. If I haven't responded to comments, I will when I'm back in the office on Thursday. And then I just kind of wanted to thank Martha with TC Media for covering in room 280 this week. I appreciate it very much. Pending any questions, that's what I have.
What did you say was on my desk?
The copy of the atrium design.
Oh, yeah.
It would have been not last week, but the week before.
Yep. Okay. Any questions for Megan?
No.
All right, then let's go to legislative update.
I don't have any legislative updates for you.
Then let's go to the Accessible Advisory Committee.
Yeah, there's the briefing the county auditor provided to you related to the creation of the Accessible Communities Advisory Committee. I'm just going to bring this to see if the board wants to take any particular action related as a result of that briefing.
Just with the explanation with the other auditor, I think it's, great to explore it. But what are the steps that we would need to take? I mean, do we need to have legal and risk kind of like be like, okay, this is kind of the guidelines that you need to set it under?
You need a letter to the governor's office or something.
So just a letter?
Yeah, it's a letter from the board.
An auditor would take
And the auditor will convert, I think he has an election.
BAAC, Voter Access.
Thank you, and that will,
Accessibility
with this letter, will play the role of the Accessible Communities Advisory Committee.
And then could we say kind of like what the other commissioners said, and we won't give a penny to you, like for, what did I don't remember, that was the auditor, she made a funny remark saying, they told me they wouldn't give me a penny for this. So, since it's not a budget request and it's not gonna have a budgetary impact to us, that was the impression I was left with.
I'm supportive. You guys had a lot of questions and the auditor tried to answer those. I don't know if you're satisfied with her answers. I was, so I'm in favor of forming this. I wanted to do it before we even had the auditor volunteering to stand it up, based on community input that I got when I first got on the board. Now this has been handed to us on a plate with a committee that can basically convert to another committee and expand the scope of what they can do. So it seems like a good thing to do. And the auditor's enthusiastic about it.
Are they gonna have to go by the OPM? Is it an advisory committee or?
So, any perspective?
I'm not against it. I'm just trying not to overload the plate.
So I will reach out to the auditor's office for them to submit an AIS for take an action.
Well, remember, it's not creating a new committee, it's just,
Expanding,
yeah, kind of
basically.
just changing one up. Although it'll be probably more complex in a sense.
Okay, thank you.
Okay, then we got, let's see. We've got resolution 16067.
Yeah, Commissioner was asked last week and the board agreed to bring this item to your attention for discussion. And this is resolution 16067 is what the majority of the board passed, requiring county employees to get vaccinated and in lieu of vaccination, go through weekly testing. And you receive a couple of emails from a county employee. I believe that's the reason as to why Commissioner Edwards would like to have this conversation. And this email in particular, it makes a leap between the legislative action that you took versus OSHA. And OSHA is the Occupational Safety and Health Administration. I have touched base with HR as well as our attorney. And it's two different tracks on this. OSHA is the Occupational Safety and Health Administration, which provides is the enforcement arm for employee safety at the workplace. When the federal government, President Biden, issued a mandate similar to what you took, they asked OSHA to provide this guidance. And OSHA provided the guidance, and that currently is being challenged in courts, and that guidance has been suspended. That is the argument this county employee was making in the first instance.
And I guess my turn.
No,
no, go ahead.
I'm
Go
not
ahead.
yet.
No, I thought you must have taken a breath. Go ahead, sir.
So, in what I asked is the attorney to look into the perspective is when you took an action on resolution 16067, on that particular piece of legislation, you did not tie any of the legislative action to OSHA or LNI. Because LNI is the state enforcement arm for public workplace safety. So then remains the question that I asked to our attorneys, whether the board has the latitude to implement this mandate without OSHA implementation, and the answer is yes. And even here, specifically under OSHA, nothing in this section prevents employers from agreeing with their employees to implement additional measures of these sections that includes requirement for vaccination and testing. And that's how you took. So it's two different tracks, two different issues. No, it's not in conflict, and I believe there is nothing to perhaps worry about from the legal point of view related to this resolution 16067. Since we have implemented this ordinance, and I have some numbers for you. We have 1,259 employees. 96.7% of the employees have already aligned to the mandate on this resolution. Meaning that 1,063 employees have provided proof of vaccination. That is just about 84%. 156 employees have obtained the testing option, and 40 is others. And the others is related to the courts have a different type of mandate. They don't have the option of testing, and they have some exemptions they have going through that process, as well as some employees they have on extended leave. They're not coming to the workplace. So the 4 employees is a combination of things. So what the numbers that you perhaps need to concentrate, if I may, is 1,063 employees have provided proof of vaccination and 156 employees go through the field testing. If you ask me, that is a very successful program. So that employee asks you two options: to rescind this resolution, to put a pause perhaps. And again, I'm just responsive to what Commissioner Edwards wanted to bring this item for discussion. Now I'm taking a breath.
Now you're taking a breath.
Doing that would not affect the courts, for example.
No.
Because they have their own rules. Go ahead, Commissioner.
Okay, so the reason that I brought this forward, okay, I recognize the democratic process, okay, so I wasn't in support of this, so this isn't a backdoor way to get my way, to take my ball and go home or something like that. What I'm talking about here is, initially, we were gonna have like herd immunity when we got to 70% of the population, is vaccinated or something. And the goalpost it does keep getting moved. And during that process, we've also had court challenges now. And although we don't have any that I'm aware of right here in Washington that has moved forward nationally, I think there's been 6 or 7 courts now, just different federal district courts around the country that have kind of put a stay on President Biden's mandates, maybe is the best way I can put it. You can't, wait a minute, you've got overreach here. He's appealing that, I'm sure. But those that brought it forward are saying, well, no, we don't want our people getting fired or that kind of stuff. So I'm trying to come up with a way that we don't take any action. We've reached, okay, we've got 96% have followed, but 84% have been vaccinated. The other ones are staying home or testing or doing whatever they're doing. I really don't know. But I would think that we've accomplished the mission, and I don't want to be involved in terminating any employees for not following the mandate, for whatever their reason is, health, religious, aggravation. I don't know the answer to that. So I thought a simple way to do it would just put our own resolution on stay, if you will, so we don't take any action against any employees. And here's why. I think when this is all said and done, if we were to terminate a person for not following the resolution, I think that person is going to be made whole at a later date. I don't even know when that's going to be, but there's going to be a lot of class action lawsuits, I think, that come out of this eventually. That's just my own personal opinion as this thing settles down. And why should we continue kind of marching on? People that have asked me, I said, well, if I was in your shoes and felt the way you do, I'd wait until I got a letter of termination before I left employment, because I think that's going to be worth a lot of money to those folks eventually in the future. I'm not giving them advice, I'm just saying, well, that's what I'd do. Anyway, so either rescind it or put it on hold or just make some kind of a decision that until this is adjudicated in the courts, we're not taking any enforcement action against anybody. I think we can still have the safe working environment that we're following in now. We just had another breakout somewhere. Where was that? Across the hall? Or you're not talking about that? Oh, Hill. Okay, well anyway, we have problems that come up every once in a while, and we're dealing with them. And we got this new virus now. I think there'll be a new one after this one, this variant, that comes forward. And apparently this one isn't as bad as they said. I think it's a mountain out of a molehill, to be honest with you. If you catch this thing and die, I don't think you'd look at it that way though. You know, so I know some people can get seriously ill and then some. So we're gonna have to start living with this thing at some point, but the courts have interjected to a degree. You, sir, are more expertise in that field than I am about what's gonna be coming. And I'm just saying, why not put it on hold? That's what the courts are telling the president to do. I don't know if the president's gonna do it or not. I don't know what his requirement is. Separation of powers type of a thing. I don't know where they're at. That's all. And we've been contacted by employees that have asked. And so they know I'm sympathetic to their cause, and I probably hear about it more than you guys do. I would guess.
So, a couple of things. Unless you want to jump in. Just a couple of things since you specifically referred to me. My understanding is that legally, it's really a different, as Ramiro said, two different tracks. I mean, we did what we did before Joe Biden did anything. And we did what we did because our governor said, I'm doing this for state employees, and I'm encouraging all local governments to follow this, and we respected that strong suggestion, policy suggestion from the Department of Health. And why Biden couldn't do what he's doing, he did his thing about 100 employers over 100, and we were like, well, does that apply to us? And then we were told, well, yeah, it might, because OSHA, for local governments that have signed on to OSHA oversight, then it would apply because OSHA is going to come up with these regs, and we are one of those states. So, I mean, it's really different what the federal government's. I don't think I've heard nothing. If I were to believe that Governor Inslee's directive, for example, for state employees, was being overturned in the courts, then I would be saying we should do exactly what you said. But I don't think the challenges to the federal government policy affects the state policy. I haven't heard that yet.
Okay.
And if I'm wrong about that, then now that you raise a different thing, you raise a secondary thing. Well, aside from the legal challenges, should we just do it because we've accomplished the mission, as you said? We've got enough people vaccinated, and there could be litigation in the future. We don't know. I mean, you're right that the goalposts are moving. They're not moving by our leaders. They're moving by a virus that isn't doing what we want it to do. And if we get to a point where, this is a predicate to what I'm going to say, is that if we get to a point where it is known that the vaccine is of no benefit any longer, then we've got to pivot. I mean, we can't just keep doing something in reliance on a decision we made when things are changing. So I don't want to make it sound like I'm just going to hold on to an old decision, but we still have good, Dr. Abdulmalik this morning said, it is still good for the community to have higher and higher and higher vaccination rates. So there is still value to our policy, and for us to do what you suggest, I think would be kind of a slap in the face to the employees that went out, didn't want to get vaccinated, but did, to keep their job, to try to step up and protect the community. And then the folks that just held out to the last minute, don't have to do it. I'm not comfortable with that, given that there's still a rational foundation for the policy. So that's my concern there, but I'll turn to Commissioner McGinn.
No, I have kind of the same thought process as you, Commissioner Menser. I mean, just the fact that, our vaccination rate for employees is, so high. But with the new positions that we're adding, I feel like it's also, good that we have that resolution in place for the new employees that are coming in. As well, to kind of just again have the overall protection. But I have the same thought process. At this time, I'm just not in the place where I would want to rescind it or put it on hold. I think we still have a little bit more work to do before we're at that point. So, that's just
how I feel about it.
Well, let me just pass on something else. I mean, you know, it does, I can see where it'd be kind of like a slap in the face, granted. But so was, you know, government gave out, you know, that to get more people in, somebody already went and got a shot, but then they started giving people $100 or whatever it was.
And I said I wasn't real excited about that.
Anyway, so I mean, it's just an extension of that particular problem. But I will say that we've got offices here where we've got certain individuals that are vaccinated, and then they've come to work, no testing or anything, but they've been vaccinated, and they came to work with the virus after they were vaccinated and passed it in the office. And this is some of the notifications that we've had. So it's not a fix for the problem either. If we're really going to fix everything, I guess I don't know, maybe we could, should we give every office environment a thermometer or something? You know, the ones, if you go to the dentist office, you know, they're hitting you with the thermometer and, okay, come on in. You know, they're not even asking the questions as much anymore, I don't think. Okay, have you been sick or you been exposed? But you got a temperature, you're out of here. So would that be a better solution towards overall wellness to all of our employees? Is that an option that we can? Because being vaccinated is no assurance that you're not gonna pass the virus on to others anyway. So that's, it kind of makes it not quite as important in my way of thinking.
Well, and I think if I may, at some point, personal responsibility needs to play a role.
Sure.
Because even vaccinated or not, if you're symptomatic, temperature, you have to stay home. That's the guidance that we have.
But some people don't even know they've got the
And
bug.
and I think what we have an issue perhaps is masking.
Yeah.
We still have a masking requirement in place. And some may not be practicing that.
Yeah, I don't think these masks particularly work, especially if they get down over your nose.
The only thing that I can is what the public health guidance is giving us. I am not an expert. I am not a scientific individual that can say whether a mask works or not, the rate of vaccination is good or not, what is the herd immunity. I don't have that. I don't have that level of expertise. But I do believe the best tool to manage this pandemic is vaccination. And I'm a strong believer of that.
I'm not saying not get vaccinated. Robin had her hand up.
Good. And this is to your idea of issuing thermometers to every office and department. We talked about that early on, and the guidance that we received from health was that if you have somebody taking temperatures, it needs to be somebody, it can't just be like Amy or Brandy. It's gotta be someone who knows what they're doing, who's registered, that is their job. There's all this stuff that came with it that we said, no, we're not gonna do that. Instead, every employee is supposed to monitor themselves before they come to work, and when they get here, there's still sign-in charts where you're supposed to sign in. I don't know if everybody.
I don't think they do. But
Are supposed to. If we were ever asked by L&I, we'd be required to produce those. But like every morning before I come here, I have a log, what my temperature was this morning. And there's supposed to be self-monitoring, and then as Romero said, if you've got symptoms, you are to stay home. And L&I requirements for having an open business, if you think of government as a business, to be open, we have to be following that, and we have to be sending employees who are sick home. That is our requirement as an employer.
Yeah.
So, no, we should not be issuing thermometers, in my opinion, and every employee has to be take a little personal responsibility, monitor their symptoms. And if you're looking at someone who's sick and you're a manager, you should be sending them home.
Well, I don't disagree with anything you said. It's just that the reality of what happens. So now I go to lunch and I have lunch with, I don't know, a group, somebody in there got the virus, and an hour later I sneeze or something. I don't know. I mean, there's none of this stuff is for sure. I mean, this mask I've got, I pitch it and stuff like that, but you know, if you've got anything that's getting out here, anything out here or whatever it is, they're not secure like a real mask used by the EMTs or something. You
They're
know,
not
I mean,
N95s. You
Yeah,
don't have
and,
to be fitted to wear them.
I think we're at some point, we gotta get back to normal. I don't wanna get this virus. I'll tell you, I don't wanna get it. My family, not my wife, and not I, but almost all my kids and grandkids have had this thing. And, they're not around me all the time, but a couple of them got sick and a couple of them didn't, but they all had it. And so I think the chances, we're ruining our society, in my estimation, by the 1/100th of 1% that are gonna die from this. We don't have, at some point, we gotta get back to normal, and get to doing life as normal. And this is gonna be very much like the flu or a cold. And somebody in the office gets it, it's gonna go around more than likely. I don't think we can ever prevent it. I don't know why we just don't learn to live with it and get on with it. That's a broader discussion, obviously, than what I'm bringing up here. But my feeling here was that I think we're still overreacting, because now, a couple of weeks from now, we're gonna have another variant that comes forward. Oh, we gotta go do something else, you know. I don't think that's the case. I think we better accept it. This new variant, not particularly bad, I guess. That's what I'm hearing on the news anyway.
Determine that yet,
It's,
according to Dr. Ophthalmologist this morning.
Well, I think they're kind of hanging on to we're in charge, I guess. I don't know what they're doing, but I think we gotta move on with life. But that's where I'm at anyway. I just thought I'd bring this forward to see if my seatmates felt that we could
Based on
stay
the
this.
conversation, no action.
No action, it sounds like to me. But did you notice that, you told us we'd get out here early?
So I have nothing else for you this morning.
Okay, I do have one other quick,
I have a commissioner item too.
okay.
Okay, I've been having a lot of calls from citizens, from several business owners about catalytic converters and the increased of theft for that. And we had also, our offices are now getting impacted by that. It happened with one of the coroner's vehicles last week, I believe. And so I'm not sure what we can do, if this is a conversation we can have with the sheriff, and we need to pass an ordinance. But I'm getting a lot of calls from concerned citizens about this because it's affecting their impacting their businesses.
Have they suggested an action?
Actually, one of them, Mr. Carlos Diaz, I spoke with him yesterday, and he owns a transmission business. And he was saying, is there a way that we can, just have conversations with the people who are buying these, and try to basically prosecute them if they're not really following the rules of tracking the VIN number, because you know, these are just getting.
Are they a bin numbered item?
I'm not sure.
I
He was
don't-
just,
I
that's
don't
what
think
he
so.
was just suggestion, and I don't know enough about it. I don't know
So
enough
some-
about vehicles.
Someone steals it and then where do they sell it to?
So I think they're selling it to scrap metal vendors.
So we'd
And
have to go to the scrap metal.
yeah, and I think that's kind of the cycle of
I
business.
think the police have been doing that for quite some time. Same thing with theft of copper wire. You know, a lot of times you hear a new construction
sites,
site,
yeah.
they just
That
pull
is
the
the
stuff
issue,
out.
that is the issue here. They have a code of copper, and that is the
So,
price.
Same thing, it's another way. to-
yeah, I think on the catalytic converters, there's some kind of rare metals. I guess I've heard there's platinum in them or something like that, like $100 worth of platinum or something, but it costs you $1,000 to get your car fixed if they take yours. And what they do is they get under there. I remember you asked about a bottle jack one time, because one of our own cars was jacked up out here in the lot.
Oh, yeah.
And I think they did not get the converter. Somebody scared them away. But they get under there with electric sawzall on these batteries. They just get under there. Bzzz, bzzz, they cut it off and take it. And they sell it for probably $50. They probably, if they would work that hard on a regular job, they'd be way better off, but they don't. You know, they're
So,
out there in the middle of the night. I don't know, but I think this is just an extension, a start of what's going on, you see down in California and stuff now, where they're following people home and they're grabbing their purse and they're not prosecuting any of those folks. There's no penalty. If this person gets caught, I can tell you that Yelm caught 2, I think, and they had a whole carload or pickup load of these cutoff deals in their car, or in their vehicle. And they don't get anything out of it, it's just a petty theft type of a charge, and they don't end up with anything. And that's what our system doesn't seem to be holding people accountable, and now that's expanded to robberies and such. You know, the difference between a burglary and a murder is the victim interrupted the person committing the burglary, and they got scared and hit them over the head with a crowbar. Because I've actually personally investigated those kind of cases.
I also had when I say I've been getting calls, I don't know, I have no idea anything about cars, so I don't know why me, but, you know, I also had a single mom call me and her catalytic converter got stolen and she was just in distress because she was like, yeah, and it was gonna be over $1,000 just for her to replace it, and
Oh, yeah, it's a
so,
big deal.
you know, and I think yesterday with the conversation I had with Mr. Diaz was when I was
Happened to
like,
a friend of mine, it was actually, his car was at I think it's a car repair shop, and they hit him there.
Jeez.
Parked out
I mean,
front.
he
So-
had some insurance or something, but still, it's like,
Very,
you
very,
know, the car for a couple of weeks.
Very, very complex issue, but it also is very limited, in my opinion, as to what the board can do.
yeah, I just thought I would bring it up.
It really is, you cannot put yourself in the position to dictate the sheriff's office as to how they can police that aspect.
Well, I'm sure they do what they can do,
Yeah, I'm
but
sure.
when they get to the system, it becomes just a misdemeanor theft.
Well, yeah, and the board cannot dictate in a way.
You can't tell the judge what to do.
That should be a
Prosecutor,
felony, though.
the prosecutor had
What's
to,
It used to be 250 was
Now it's
felony.
750 or something?
but I can see the frustration, certainly.
I don't know the answer to that now, but
I know they keep wanting to pump it up, but I don't know
Yeah.
if they ever got it up there.
it's minor in the scheme of things compared to getting robbed with a gun or shot or
Well, I
stabbed.
think you said purse snatchings are usually robberies because they'll
Yeah,
say use
because
of
it's
force.
physical, right?
Physical.
But
And
mostly
that's-
they don't file on them.
Washington,
I mean, they don't file on them. Go up in Seattle, that's a big bugaboo deal. up there.
Anyways, I just wanted to bring it to the board's attention just because that's been kind of the calls I've been getting about.
That's tough.
Hey, just one real quick thing. This contract thing that Mr. Pettit sent in about the atrium and the spots not filled out, did we bid on the deal? And the city permit being $2.5 million and we're looking at spending in 6 or, I don't know. I mean, what's the deal there? I mean, is that, did we bid? Did we not bid? I think yesterday we bid, but then
I didn't understand.
I didn't understand.
Just to piggyback on him, I did not understand what he was saying about the Olympia
I
and,
don't understand
that.
what he's saying about that. So I will not be able to answer that
Okay,
question.
can I get a copy of the contract that he's referring to
I think,
here?
yeah, we can give you a copy of the lease.
Yeah, the lease, that's all.
Yeah.
Yeah.
A copy of, and,
Yeah, give me a copy of that.
I think the
Olympia
question,
submitted,
No, somebody
The
got a building permit for two.
building owner got a permit to do the work, to do the tenant improvements in the atrium building. Tenant improvements, things like laying cable, building walls, moving the plumbing so that the little kitchens are in the place that everybody wants them in. You've got to get a permit to do that kind of work, and
right,
that's
but he
what
was
they've
trying to
done.
talk about the discrepancy in the dollar, estimates, I guess is what he's talking about.
So I have no idea what they submitted for those improvements, apparently 2.5 million. And that's part of the,
we're gonna be paying true cost of the tenant improvements.
right.
We're not gonna be paying,
I know, but he's saying, can you invest, Mr. Pettit is saying, can you spend public money on a building that you don't own
Yes, we can.
that has been
and
already
not,
addressed.
you don't have to bid on any of that stuff?
No,
Oh, okay, well then maybe that addresses it.
The REIT one money, the whole conversation, whether it's legal or that has been addressed on many occasions. And we have a Attorney General's opinion, the REIT one is an allowable cost. And in including tenant improvements on a lease, that is not unusual, that we have been practicing that. We practice on Challenger Court. When we have the lease and the tenant improvements was managed by the owner and we pay true cost.
before we bought Mottman, Mary had all kinds of tenant improvements done to that building.
So, and that is my personal experience in First County, we went through the same thing when we have remodels and lease, the owner goes through a tenant improvements. The question at that point is two options on the tenant improvements, whether the tenant improvement cost can be added to the lease or the tenant improvements can be paid outright. And that's what we're doing, because we wouldn't add it to the lease cost.
Right, we wanted to minimize the ongoing
Yeah.
impact to the lease payments. So we're paying for the tenant improvements up front, and you've authorized up to 10 million. We're not gonna spend 10 million on
Which
them.
includes IT and furniture.
That's right.
And going through the lease, when we work with our attorney to review the terms of the lease, he said, you need to take the furniture out because the furniture has to be bidded. And we're gonna be bidding the furniture.
Right.
The other part I was confused on, Mr. Pettit, was that, it seemed like he was saying we should raise taxes, build a new courthouse, and don't invest in this new complex.
Oh.
He said that multiple times.
Yeah, he did say that.
And I felt like maybe I wasn't.
You thought you were in a twilight zone?
I didn't, given I've spent a year hearing the exact opposite, I just didn't really know what to make out of any of that, other than
Well,
it was the opposite of what we were doing, which seems to be the prevailing.
I have to say, I'm not, I'm not enthused about going to the atrium thing.
Did you hear what I heard?
Yeah, I did.
Okay, I just wanna make sure I heard what I heard.
I think he
Let's
probably
stick on a
wanted,
pay.
he wanted the cheaper way of doing business, kind of like what I did. Lease these office spaces right here on the hill, remodel.
He said raise the levy lift and build a new courthouse. He said build it here maybe.
Yeah, build it here.
But build a new building that's adequate for the needs. Do not remodel something we already have, because that's putting lipstick on a pig.
Yeah.
He wanted to build a new adequate facility.
I think we ought to have a discussion about that particular issue, but I know it's too late now because we got a lease going
Okay,
now.
I heard what I guess I did hear right.
So I do want to say one other thing about the tenant improvements at the atrium. It does not have to be bid, but it is a public work. So they have to pay prevailing wage and follow L&I rules regarding a public work.
And
So
they know
you
that.
hear that,
They know that.
that is part of the lease.
And we pay true cost. Because when we provided a sense of magnitude to the board, how much it will cost, furniture and everything else is up to 10 million. But related to the tenant improvements, we pay true cost.
Who determines what true cost is?
Well, the actual cost.
We will be reviewing
Yeah.
all of their records of what they pay for, and we will
Time.
reimburse them.
Time and materials.
Okay.
And that's why we go through the process.
And that's part of the work of the accountants.
Great. Okay, we're adjourned for now. We'll be back at 1:30.
We did pretty good.